our voices, let's give them all the praise for the stories they tell and the moments they save. In Western North, they're the voice we hear. Selwyn News is number one, let's make it clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we build in our tribe. Selwyn News, oh Selwyn News, for the pride of Western North. With every click, with every view, you're showing all your worth. The best online portal, with passion burning bright. Selwyn News, we stand with you, we build in our tribe. In Western North, there's a name that shines so bright. Selwyn News is the one capturing every light. From training sessions to breaking news, they've got the scoop, bringing clubs and players closer like never before. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we build in our tribe. Every festival, every game, every political news, Selwyn News is there, bringing news to light. For the love of the game and the fans who cheer, Selwyn News is soaring high, making it all clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we build in our tribe. Raising our voices, let's give them all the praise for the stories they tell and the moments they save. In Western North, they're the voice we hear. Selwyn News is number one, let's make it clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we build in our tribe. Selwyn News, oh Selwyn News, for the pride of Western North. With every click, with every view, you're showing all your worth. The best online portal, with passion burning bright. Selwyn News, we stand with you, we build in our tribe. In Western North, there's a name that shines so bright. Selwyn News is the one capturing every light. From training sessions to breaking news, they've got the scoop, bringing clubs and players closer like never before. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we build our tribe. Every festival, every game, every political news, Selwyn News is there, bringing news to light. For the love of the game and the fans who cheer, Selwyn News is soaring high, making it all clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, rebuilding our tribe. Raising our voices, let's give them all the praise. For the stories they tell and the moments they save. In Western North, they're the voice we hear. Selwyn News is #1, let's make it clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, rebuilding our tribe. Selwyn News, oh Selwyn News, are the pride of Western North. With every click, with every view, you're showing all your worth. The best online portal, with passion burning bright. Selwyn News, we stand with you, rebuilding our tribe. In Western North, there's a name that shines so bright. Selwyn News is the one capturing every light. From training sessions to breaking news, they've got the scoop, bringing clubs and players closer like never before. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, rebuilding our tribe. Every festival, every game, every political news, Selwyn News is there, bringing news to light. For the love of the game and the fans who cheer, Selwyn News is soaring high, making it all clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, rebuilding our tribe. Raising our voices, let's give them all the praise. For the stories they tell and the moments they save. In Western North, they're the voice we hear. Selwyn News.
Emma Makwaba at the mobile Kro Yi Mu Nsem Jumadi, Nana Asare Kesse Magia Kunya, and the Yababe discuss the Niama Bibre. Now, Niama Yababe discuss, very important, because Eba Yapumdi health is very important. Yati issue be a coastal within Ashanti region. Yura Kwanamita Kando, Minister of Health, and Sembia PPM. You bid him come on Nafi. Yate say employment be a basel for nurses, 16,000 nurses slot be eba for nurses this year. Non so enra yura minta kando e can be ewo 2026 summit from Ministry of Health. Na some of kind nurses this year umbefa nurse for be 16,000. And also you're bidding common your room. Nafi, I share hospital how do I all Western North Komobi also concerning hospitals how do I air also within Western North, even NDC, MPP, by hospitals are what's the concern? Even Ghana, Western North, Uba Western North, do we even have accident and emergency unit? Because I know who be and I know same BAP or air conference teaching hospital. Am I suspended a Dr. Parkwesi Bedu on our CEO for conference teaching hospital. Decision be or make ye be ramne ye think more after and no hunty. Oh, share of Facebook, YouTube, and TikTok, but more than answer like video no afei share video no ɛma yɛn YouTube so ka hu sɛ wobɛ subscribe yi na wahyɛ ama yɛn sɛnea ɛbɛyɛ a wo nua bi nso ɛwɔ fie a wobɛtumi ahwɛ bi TikTok fa wo sabo screen so na like video no na afei share video no ɛma yɛn na biribiara ɛnkɔ kama yes Sahwi News yɛaba ama Western North yɛaba ama Sahwi ɛne ne mpatam nyinaa baabi a wohwɛ yɛ biara no ka hu sɛ yeah, main focus ne say you be expose things that's going on within Western of good or bad. You be can want some then you're the resource person or you're a very important person. I be din komo na watch nema air costo within our region. Echna yeah sure say echna you benya obi afi air planning officer be a beba e studio ha na ye na be din komo kakra afa yes so he also journal say plan yɛho flooding bebree a ɛrekɔ so wɔ Accra, capital of Ghana. Yɛhwɛ a saa adeɛ wei within 5 years sɛnea yɛsisi dan within yɛ community yɛba sɛhwedwena ase ne yɛɔ so a wogye di sɛ 5 years to come you experience the same issue anaa ɛkyɛn yɛne no ɛbɛdi nkɔmmɔ because ɔno na ɔsupervise sɛ saa nneɛma no ɔmbɛtumi atake care of nti ɛkyena yɛne no bɛdi nkɔmmɔ na afei Maslock fɔ nso yɛne ɔmo atwetwe nkɔmmɔ afa ɛyɛ loan bi a wo a woyɛ business wobɛtumi akɔgye bi application ne nenam but megye di sɛ wonte Sahwi News yɛba bɛinforme wo na woahu neɛ sɛ woyɛ ansa na woatumi akɔgye bi ne nyinaa ɛyɛ discussion a yɛde ɛbɛbrɛ wo ɛkyena nyamboa abra abɔfoɔ pɛpɛɛpɛ ɛwɔ studio ha wo sɛ Sahwi News yɛaba ma Western North and we are bringing you all the information you need and to your doorstep wate aseɛ ɛno ɛyɛ borɔfo ɛno a meka aborɔfo bebree ɛno a yɛnya Rutab ɛwɔ studio ha na ɛno no afifa ɛde newspaper front page no bɛbrɛ wo no a ɔde brɛ wo a ɔbɛwura mu na wakɔde bɔkɔɔ ama yɛn but nsɛm a ɔde ba no ɛbu oduru nti ɔde ɛno nso bɛbrɛ na biribiara akɔ kama ma memfa nsɛm baako mmienu bi a ɛrekɔ so within ɔman mu including Western North na ɛyɛ important to yɛn a yɛwɔ Western North no na yɛn nyinaa yɛnsua adeɛ ɛmfiri mu asɛm baako a ɛpie mu over the week this week ne sɛ teacher ne bi ne school akwadaa bi anya asɛm kakra ama ntɔkwa bi epie mu na ntɔkwa no pie mu na mahu sɛ Ghanafoɔ deɛ yɛbɛtwerɛ few minutes later wate aseɛ na few minutes later ne baeɛ na teacher ne no ɛyɛ adeɛ a policefoɔ akɔfa no ɛsiane sɛ wohwɛ comment section ase a yɛatage Ghana Police Service yɛakɔtam teacher ne no yɛde no akɔhyɛ mu abra yɛma student na ɔyɛ ɔbaa no yɛma no medical form sɛ ɔnkɔ hospital for medical check-up na wohwɛ ntɔkwa no sɛnea ɛkɔ no a na ɛnyɛ adeɛ a teacher ni na ɔyɛ bɛrima no ɛbo student no na yɛ adeɛ ɔmo ko ankasa ɔho saa arrest no a ɔbaa ne bɛrima ɛbɛhyia sɛ teacher ni no anyere ne ho anka girl no koraa abɔ no ɛka ketekete anka oyi ne to fam koraa abɔ no koraa anka ɛno nso ɛbɛyɛ another story but teacher ni no kind of discipline no ɛkɔ too harsh ɛma pagya ne de ne bobɔ hɔ ne saa nneɛma no ɛkɔyɛ nsɛm bebree nti nkurɔfoɔ bebree ɛtage Ghana Police Service ɛma Ghana Police Service foɔ so ɛkɔfaa teacher ni no na asɛm wei ɛsi wɔ kuro a yɛfrɛ no nyinahini okay ɛno ɛwɔ ɛyɛ Ashanti region ɛhɔ na issue wei ɛsiiɛ na awia no mu information ɛbaeɛ ne sɛ NAT Ghana National Association of Teachers as I say ɔmo de information bi ba abɔnten sɛ teacher ni na yɛakye no ato mu a lady ne deɛ yɛama no medical form sɛ ɔnkɔ for check up no ɛyɛ adeɛ a ɔmo nte aseɛ because information na ɛbaeɛ na ɛkyerɛ sɛ teacher ni sisi akora ne tablet ɔno nso na ɔhwɛ hostel na ɔmo da baabi a nkwalaa ne da no teacher ni na ɛhwɛ saa hostel no so nti because I need campus no nti omo say ebo 9 so bia eba back to hostel ba akra no omo amantem and oma others are omu njintum girl na dey outsiders for by ema beto two stones e pa teacher in class na niam bebre na chese akra no watra be careful ono a the ni decision e hye ne nsam na chese omu teacher no nti enumu no na yesi oni teacher na prepare so anka oyi teacher na abo ha nti ending video no na ye hu ye no ene say secretary say teacher ni na abo student no nti not for the information but say omo yi teacher ni no because time issue na see ya omo koche no teacher ni shema ye man ni bill nti omo say omo yi teacher ni no ama teacher ni so wan koye medical test an hwe say ne ho eye na omo anya investigation no mo di teacher ni mo ma ko shema basa na ye say justice no mo 7 no it's not right nti basa omo nso wasie omo ba betwe say omo start wasie me omo be boycott nti Ashanti region teachers when nyina nat for say anko omo be boycott sa wasie no their teachers for no supervise na che say English no sa who borrow my newspaper Afifa borrowed my newspaper no na che say omo ntimi entro nti omo de by awia ni mu ba eba nwumre a me ba be start program na ma say ya beli teacher ni na sisi amene wo kasa teacher ni no yayi no afi aban kukumu a omo ye still na omo ye investigation based on teachers for no mo ho no na chese nkwala no aso den sisi GS ne mpanyinfo say nkwala no ma ye nhwe omo na ukọ kro bi efe no hom jibra Anglican school bi a me ko bi pa na edu ebo 7 boss 7 na say oye we o student ya ye late cry o hu teacher ni obegwa o ye nyina wa on be ma number wa assembly o wa ma ye begwa what ya say so ni nyina no na ye the discipline ye say na ye be bibia on time say na be ya niam be koye na so they say ya o ma yi afi mu say my teacher ni enhwe students ma ye introduce kin in our school system no I say niam call some way apart from private schools no okon government school there will be try videos and then men kwala omuja assembly hall omu kitwa bi o so na school hɔ ayɛ ma ate asɛ nso assembly no ɔmo ma because obia feel say teacher ni wuntimi nhwɛ me because Ghana education service say ma yen discipline nkwala no I think your educational system no aba no yɛ very important even if you cry your parents they aba not that they are punishing us per se but it's a guide for us to follow and also do things right nti yi aba ne saa nneɛma no free school ma ɛbɛha adwen ɛne sɛ hwɛ sɛ teacher ni any student atam so at student ɔba o na ɔhwɛ sɛneɛ ɔnwa teacher ni no a hwɛ sɛ ɛwɔ Dixon yɛ teacher ni na obia sɛ ɔbɛbo no kuno ate asɛ nti yɛnhwɛ no na yɛhwɛ no so nti ɛno so ɛna ɛwɔ hɔ saa na education minister ɛyɛ Erina Idriso ni din na no or the aba say BEC on person change days if 5 days equal 8 days no na omo edi ho komo ahwe say on betimi asesa days na free 5 e dey akọ 8 na eba ne sa ebi mo mo chro objective no any full paper 1 day nti eba sa na eche say be 1 paper ebi o ha obe chro 1 and omo mo ye French na sa na ema no and also ye nsem bia ekoso ewo ho na attention bia unity ewo Afari military hospital na sa hospital we ewo Asante Mantem na issue a eba ya no concerning CEO suspension Afari military hospital free for person body ni kire me ba monka ho say hospital ewo Ashanti region asi ho a yen complete ya meaning say ye guess ne ba ono so be ka ho asem kakra na attention aba ne say NPP government omo yomadwe so omo kwa inspect project no ahwe na omo say omo nya some blockages from the military pushing them away from entering the premises nti eno ho nsem enso na twa go no because minority MPs no person omo inspect that abandoned project no o hwe cement ahodo a ye togu ho a cement ni nyina say ne keka ho a yɛbɛdi nkɔmmɔ ahwɛ the impact of these things, because meka wei not because if you Western Obeka say you don't care, but can who say yɛn nyinaa yɛtua tax one way or the other. Mo a motɔ nneɛma koraa wɔ Melcom ha no, motua paa. Wogye wei na wobɛhu sɛ tax bi wɔ aseɛ. Toɔ no wotua na kyerɛ sɛ ne nyinaa ɛna yɛde boaboa ano a na yɛde akɔyɛ saa project no. Ɛna menim sɛ sometimes yɛ issues ɛwɔ Western North ɛgye yɛn nsɛm a yɛrefer some of our patients ɛkɔ ɛyɛ CAT a ɛyɛ Kofi Annan anaa ɛnyɛ Kofi Annan o, ɛyɛ Kɔmfanokyene Teaching Hospital. Ate ase a bebree naa nim sɛ yɛfrɛ no G, wote G a ɛyɛ no a Kɔmfanokyene Teaching Hospital. Nti yɛwɔ hospital bi wɔ Kumase a ɛbɛn yɛn a yɛbɛtumi arefer obi wɔ Western North akɔ hɔ. Yɛde yɛn tax paying money ɛna yɛde si na sɛ yɛgya asi hɔ na issues bebree aba concerning the traffic a ɛwɔ G, mame yi so G sɛnea ɛbɛyɛ a wɔn nso bɛte ase G hɔ na ɛkyerɛ sɛ ɛno ho nyinaa na ɛde saa nsuansoɔ no aba ama issues na ɛrekɔ so with our health minister Yewura Kwabena Minta Kando ne ho akɔdi mu saa na wayɛ hye paa. Megye di sɛ mmerɛ pa no ɔbɛtumi atoto nneɛma na biribiara akɔ yie ama yɛn. Dwumadie a yɛde brɛ Kro Yi Mu Nsem ka ho sɛ dwumakuo bi afɔ ase a ɔrehwɛ sɛ yɛbɛtumi abɛtena ha berɛ a abɔ no 9 akɔbɔ no 6 mpa mu pɛpɛɛpɛ na yɛde saa dwumadie no abrɛ. Na dwumakuo no baako din ɛyɛ Rekoff Group of Companies. Rekoff no Rekoff sɛ menka nkyɛw sɛ wopɛ cement papapaa, Gasem cement wopɛ bi de asi wo dan a nsuo no ɛtɔ ɛyiyi gutters kɛseɛ paa, kɔgye cement no bi na fa to saa gutter no mu sɛnea ɛbɛyɛ a erosion no ɛmma gutter yi ɛnyɛ ma ahoro. Wate ase. Afei nsuo yi a ɛtɔ yi wopɛ sɛ wosave bi, wopɛ sɛ wostɔ nsuo na nsɛn. Mate sɛ Ghana Water Company for nsuo no nkyɛ bia na ɛtwa yɛwɔ so koraa pɛɛ sɛ Safrifa bɛdi madanse a mate sɛ water shortage issue bi kɔ so wɔ hɔ. Ɛno yɛbɛdi ho nkɔmmɔ, but wopɛ sɛ wostɔ nsuo a gye wo polytank kɛseɛ paa 10,000 1,000 liters na ɛstɔ nsuo na biribiara ɛnkɔ yie ɛmma. By the time a ɔmbɛbie nsuo na wɔwɔ nsuo na wɔapɔmpe bi aka ho. Afei wopɛ iron rocks a size bi a wopɛ biara no wɔn yɛwɔ ketewa wɔ hɔ, yɛwɔ sizes wɔ hɔ. Nea wopɛ biara no Rekoff sɛ menka nkyɛw sɛ wobɛnya bi ama wo. Wopɛ doors, wopɛ roofing, wopɛ paint papapaa, wopɛ nails, wopɛ window nneɛma biara saa window metal wei na wɔde bɛ ne nyinaa Rekoff tɔn bi. Wopɛ nneɛma a yɛde si dan, wopɛ shovel, wopɛ wheelbarrow, nneɛma bi a wohwɛ a yɛde si dan deɛ Rekoff sɛ menka nkyɛw sɛ wobɛnya bi ama wo. Tiles nso wokɔ hɔ a wobɛnya bi. Rekoff de concrete mixer nso aba, wotumi kɔ rente na wode ayɛ wo project na biribiara akɔ yie de ama wo. Rekoff ne head office no ɛwɔ Tano so, sɛ yɛyɛ ɔso Tano so no wɔfrɛ no wɔ 0243 317 578 0243 317 578 anaasɛ 0244 878 466 0244 878 466. Wofrɛ Rekoff a ɔbɛgye wo so na wahwɛ sɛ biribiara ɛrekɔ yie. Ɔwɔ Pena kurom, aside yɛ ɔso deɛ no wokɔ Pena kurom wɔ hɔ, adeɛ mmra kɛse kurom ɔwɔ hɔ. Wokɔ Dwunase station hɔ a wobɛhu ɔmo office na ɔmotɔn AC ne fridge ne gas cooker ne wei no. Ɛno edin no yɛ Queen Elizabeth. Woduru a wowura station no mu a wo nsa right wobɛhu sɛ ɛwɔ hɔ na wo nso akɔgye wo nneɛma na biribiara akɔ kama. Wokɔ Western region so a Pristia ne Takwa nso wobɛhu Rekoff ɛwɔ hɔ. Nti kɔgye adansie ho nneɛma na wowie a wada Rekoff ase na biribiara akɔ yie de ama wo. Rekoff no. Afei Olavia multi-satellite, DSTV papapaa. Sɛ wopɛ DSTV de ahwɛ World Cup yi bi a World Cup mate ho nsɛm ba yɛnkɔ hɔ ate ase. Ba wopɛ sɛ wohwɛ World Cup yi bi a kɔgye wo DSTV decoder na afei installation nso Ola ɛmɛyɛ ma wo. Multi TV, wopɛ CCTV camera nso a wobɛnya bi ɛwɔ Ola hɔ anaa wokɔ Olavia multi-satellite a wobɛnya bi wɔ hɔ. Solar system, wopɛ sɛ wobɛyɛ installation nso ma wo a wobɛtumi abɛyɛ ama wo. Ola sɛ menka nkyɛw sɛ ɔwɔ Sɛhiyɛ ɔso hɔ yɛ a wofrɛ no wɔ 0248 554 851 0248 554 851. Wofrɛ Ola ɔbɛgye wo so na wabrɛ wo DSTV decoder multi TV deɛ no CCTV cameras no open single one open bebree ama o business o project bi a offer na obeje also nti ola no obeboa na also wabo adwapade ho ban with CCTV cameras na wabe installation na ma kama we ene dwumaku ahodo na aso ya se ayede Kro Yi Mu Nsem dwumadi a yɛde brɛ wo da nyinaa abrabɔ no nan ɛwɔ Sahi News studio ha yɛwɔ Matcom Plaza Matcom Plaza woba ha wobɛhu yɛn na wopɛ sɛ woyɛ production wopɛ photography wopɛ website wopɛ personal portfolio wa wopɛ sɛ wobuild wo personal portfolio obi search wo din a na wo website apop up wopɛ bia free first wa start yɛdi ho nkɔmmɔ wopɛ bia wo contact a yɛbɛtumi abuild bi ama wo na bibia ayɛ kama woyɛ ayie bi menka sɛ obi nwu ba woyɛ ayie na wopɛ sɛ yɛbɛtwa ma wo a yɛbɛtumi abɛtwa ma wo woyɛ wedding engagement wokɔware wɔ northern kra na wopɛ sɛ yɛka wo ho a yɛbɛtumi abɛka wo ho na bibia ayɛ kamakama de ama wo nti wodeɛ bora ha woba a bibia wopɛ bia no yɛbɛtumi aboa wo afei wopɛ sɛ wɔ advertise wɔ yɛ program bia so a wofrɛ 0556 203535 0556 203535 wofrɛ a yɛbɛgye wo so na yɛahwɛ sɛ bibia ɛkɔ kama nti mekɔ na me ne afifa akɔdi nkɔmmɔ na ansa na mɛkɔ no ma menkae wo sɛ ɛnɛ yɛba bɛhwɛ hospitals ahodoɔ a ɛwɔ western north ɛwɔkɔ asan so dwabo so ɛho sɛ bebree aba concerning that hospital issue no afei yɛbɛhwɛ sɛ yɛyɛ also government hospital na ɛno nso yɛde ho nkɔmmɔ hospital baako nso ɛsi ɛyɛ bibie ni ɛno koraa maakɔ hɔ da yɛkɔyɛ project bi wɔ hɔ ɛno nso yɛbɛdi ho nkɔmmɔ na yɛahwɛ sɛ even accident and emergency unit no yɛwɔ bi wɔ ha mate sɛ baako bi wɔ yɛɔ so ɛno na ɛkyerɛ sɛ Rakoff ne Queen Elizabeth ɔmo na ɔmo build saa project no de maa yɛn but yɛbɛhwɛ sɛ yɛwɔ other ones within the region a na yɛde ho nkɔmmɔ na yɛahwɛ the essence of it and why we need those hospitals within our region na yɛde nkɔmmɔ no awura mu concerning nurses ahodoɔ a yɛba bɛ employ mo within the region 16 region no na yɛde nkɔmmɔ nso afa yɛwura Kandor the decision I'll make here with the suspension of the CEO of Komfo-Anokye Teaching Hospital and then bachelor so before a too short amount so I'm making wrong decision yɛbɛdi yɛn nso nkɔmmɔ then we look at some of the focus projects NDC they but within Western North region and even some of their track record about health issues within our country nti nkɔmmɔ no ɛbɛyɛ dɛ bansa na ɛbɛyɛ dɛ no mɛkɔ afifa hɔ na mene na akɔdi nkɔmmɔ kakra concerning the newspaper update a ɛwɔ hɔ from Sahi News wopɛ sɛ wɔwɔ advertise wɔ yɛ newspaper no nso so a yɛwɔ hɔ wate asɛ yɛwɔ hɔ na biribiara akɔ kama ɛde ama wo nti mekɔ afifa hɔ na mene no akɔdi nkɔmmɔ kakra na after nkɔmmɔ no wɔwura mu ama yɛ newspaper update afifa sɛ biribiara wɔkɔ
nyame adom boss
sɛ anadwo no ɛkɔ sɛn biribiara akɔ kama
nyame adom yɛda yie sɛ nnura nsuo nso tɔ kama biribiara yɛ kama yɛtumi da
ɔngɔyɛ mban
ɔngɔyɛ mban
okay River na what the issue of this teacher ni any student ɔmo ntɔkwa na ɛbaeɛ no also meaning say background kakra wɔ hɔ wobɛtumi ahyɛ o personal opinion wey dey small ɛnyɛ bebree meaning say meaning baabi a wɔde fa but your personal is wey na yɛntɔ
that's a boss deɛ ɛyɛ good news ne sɛ now no teacher no yɛtumi ama ne bill as is here we free at least police ɛyɛ hɔ a ɔno nso ɛkɔ akɔyɛ medical report ɛna is here ehia because nanka ɛnyɛ fair because yɛka sɛ nipa mmienu ɛna akɔ ntɔkwa ɛna ntɔkwa na ɛkɔɔ so no nso no definitely sɛ yɛkɔ akɔkye obi deɛ ɔsanka yɛkye saa nkɔfo mmienu because ɔmo na ɔmo yɛ victims nti ade nti na yɛkye baako gyaa baako nti wotumi sɛ na nneɛma bi ɛnkɔ yie ba because of say yankasa I'm a union panya friends and not no a berm no. Any nagrat a berm no the fact a boy Emma Ubia or ye teacher ni and a home a quadrium to me by rescue no from that situation. Until now, may far conya way so abo a employing for yabaso. Say we a member of Nat or Nagrata. Like when I'm was aqua, na bibisa atua. Omba ebe boa ebe you free sa ohanem and yes sir ko ba time we ya anka teacher na kana mo be kire ne pa because I didn't na school akwala ne de da so nam ho na teacher ni na momja tena atumu a yesi wono na emboa investigation na school akwala ne wo boa investigation na in fact enye ya na that is Ghana for you and see fast forward the boss yanko another one so now we can hospital na e wo ya anka se ye kwan so a aferi military government hospital.
Aferi.
Aferi. It's a Aferi military government hospital. Ya kwen so a ba ya between Abuakwa nyina area ho. Yeah, nti wo ba ya bibie ni, safi bibie ni kwan.
O de tambia o kan bibie o safi kan.
And fasa you can like I will not fear because most now in the entire America most now say bibie ni a part of baby Ashanti and Western Norfolk. And I tell you.
Alright.
Inti na sana wakoye. Inti what's your remwa?
Oh yeah, fire room with newspaper.
You remwa na say ya mo tie for ajo mo akwaba e the bus section news so and then you mre rare you room e newspaper review segment and you do so no me di mu chia me friend this and I dey bre atiefo na hwefo say na emunim no do so a like na share na pa comment to because the more wo ye ne sa no na je say won fefo a munya emehwe adwumadi no so munya bi eden etie san twe aka ho on the front page no ye what 3 news wo ba ko CEO of Rutap Hub Center. CEO of Rutap Hub Center was say empowering young women through skills training is my mission. Empowering young women through skills training is my mission. The yankasa ye nua ba ye mame ye sister ye nana cause me kana nan so a osanso ye nana nketesi anyina hima no ewo sabi kura ye fene say Kesse krom uba sabi yo so a na hotedin Kestan nti ka Kestan wa na obia enim say eka sabi yo so me nananom atwen konya na ya nkasa ye nua bai ya san na dwumadie wodie ne ahonfama ode ma mabru na like obo mabru ni ntino especially ma wahene na wo ho no ehwedin ye ka se daabi me nua bai ma me mo na ba so me fa ketesi ahema so san hye no so ma no adentia ma me watena se awu se daabi ya nkasa ye setwi ha sei no ene entire Western North region ha no mabru na moye ma no bebre na eni nyuma wo se oboye de omo nti wotena ase din hwese daabi na tie de a ene ya me makọ school akosua ntete akosua nimde aba me Rutap me meti he me ba to sehwe no me okosua fashion design wo Suyan Technical University sorry Takrade Technical University Takrade rather ho no kosua ye na okosua wie ye no obi akobetena krom wan tra krom no sande ba ne ono ne diem wo sehwe asase so wo Kestan na endra oba afidie mu ano o chechire ni semu ni fa me yura we pa a che na mu se yedie se na fom cause was oba na woni ni tiri ho hwe na o sha ase afidie ase obi a wako school akọ university awi akosua sa fashion design abai obi anka obeka se wo pe bibi kasi ansa na wa start dabi ma me sha ase afin ketuom na me fa na daache atimi akọwie kasiem nti wo hye niema pam no ene ne niema amedwumade nyina ewo duase ewo mo anka so mo fie ewo Kestan edidimu kakra na wode kokọ wie se ono anka sa benya shop wonya shop wie ye no ena afi wasase woje nkwala mabunu woye ma se omra mesua adwuma ewo Rutap Bridals and Creation
okay
Center nti wo hwa Every time obi adwuma se wo hye ase atete nkola no mabunu a moye mama wa tete mako wo ha ani aduosia mienu 160 young ladies ewo western of ha.
Okay.
Into what adwuma anase adwuma na yankasa yenu aba no bo no ano odene anya no ko a wo say what I mean what tell na so I mean wo pon ho wie a na I mean woja kwan a se wo ko bie wo center na so shop so dia wonya wo kwa wo wo kwa be say na wasan ba wadwuma mu wa akɔhwɛ sɛ dabi makola yi a opon no free me side no in fact na adwuma na wabie no so etesen ekɔsɛn wonya me mo ana sane ma wonyina so wode agu akoma ma ne nkola na omsa besu adwuma wa ne ho no anu bi na nra obetena ha kan ye no na wo sei wo ye wenyina se na be ya ema titiu ema a ye western of ye setwi potem ha sei no ombenya bibia den aye se na be ya wo nkonkɔ ye se sabio ene me sorry ye brakwaku ene wa mam 20 cedis a me ndidi ekombe de me fifi mesra send me 20 cedis ayansa ene adachi emididi ye sa na ema wenyi na no pese otwamu anya no nko a afa mprewa anyensen teenage pregnancy so waso pese otwamu ewo ye region we mu eno nti na watu ne ho asi wa wo bossa brawe ediama entire western of anya no nko a wo wie ye no no san tena ase din no hu se dabi one fere say why ye so be di kasibom nti wo wie na the business o ko register ye na wo ko hu why agency o ko mo office no omo so obutimi bua no wo ne aba ko mienu say nkola I mean on person be su adwuma wo ho na ye train wo mo na ye do wo to sa why program so so sa nkola nyina wo je wo mo afen so nkola mo ye kwasibo ni be ka say vulnerable like I mean or like omu ni bi kra o twen sa nipa na o papa ana so mame na se bi a make busunya obi ani mo bi o de bo sa akola no sa nkola we nyina wo say wo ba wo njo 1 cd wo njo kapre wo de bra ba bi abeda accommodation wo hostel cast facility wo ha de ma free wo uniform obesa ahye eno so free even aduane a obesa die kura wasan de ape so ama na wo mpe we na apeden utab no mo se ya wo se wo de half center be ka ho nti anya nema mpam ko anya fashion design ko na wo san ye ho wo de ntuma bia wo pese oto Ghana ha wo de bra utab creations and brothers help center sane mo na we nyina benya bi ato anya no ko a se ya mi kan wo se wo ne current MP of Sekwiyoso municipality Honorable Kofi Benta Afo wone no ye collabo kwabua kon awako bie I mean training center na say activity center na omodi atete mabunu poly 160 se ne be ya wo pese wusua se yesi yesemina ana se wo pese wusua se ne yesi ye beats sebe ahwene a ye digu yase wo pese wusua se ne yesi ye fine ne de kanka ho nyina sa ne mo nyina no wose wone ye ankasa ye MP a wo Sekwiyoso kwa akoye sa kase kolabo no a training mabunu mako 150 to 160 nti no so mabunu a mo wo Sekwi Yoso constituency a mo te ya ankasa ye die mu no especially ma no ma mo mfa I mean we endi agro mo nyina mo tiri mo tanela nko Sekwi bua ko na mo konko bua na munya nsanodwuma wo ho afa yes an ye ko another news so a
Okay.
MPP Western North Region suspends Bibiani Anyaso Bekwai electoral area elections. MPP Western North Region suspends Bibiani Anyaso Bekwai electoral area elections. So same way AC June 9th, 2026. Regional chairman Yankase Papa chairman Benjamin Ama and this same way about to dwa we say enam irregularities ba akumienu bi a ekoso ewo Bibiani Anyaso Bekwai municipality muntino MPP internal elections no omo de tabo ato say bam ene every enra ayet 9th ene ye 10th ekori nyina until further notice no ubi a we candidate wa wo ye hwanyo yeso obi a hold on on to say regional election committee no on betena say ahwehwem na asem no ye di no pepe person ye wo say ye si eka no ye kan wie na e wo say pepe ye eda ba bi din a na say ye de bibia ye den ato ba bi ye wo say ye de eto ansa na election time no kura no ya fixed official date asan ye den ama no nto obi aka na koma to no yem wenye gidigidi wenye kon wenye ntokwa ya nkasa ya ye die mu aye ya pipifo ye nyina ye osonoma nti saa issue we ya be ye nyina ye nso mu ne ye nso makoma pamu se be ya after say ye be resolve saa irregularities issues no ya nkasa ye be san set time any date ato ho ama I mean nkofo ya omo pese ye to omo so abai na abato no watimi ato na ye kama anya no nko a de atwato nso ya nkasa sehwe so municipal chief executive ya nkasa ye wura your friend say honorable sehwe so municipal chief executive ya nkasa honorable Dominic Jesse ye wura fa chairman na yam ya pressure na no dey wo betena ha na pressure na fa wo na ija tuato
eti Dominic Jesse
honorable Dominic Jesse yes ono so na anyway ya bebo mu no the can say contractor to resume work on security also astrotef on security also astrotef
okay
contractor to resume work on security also astrotef issue no into say a boss we also municipality a so we also astrotef e be hunu wo susumite o dey call regional police command wo no sa street no o fa so a bokoto sa astrotef no say ye no ho come say so we also mabru no epe bo pa school kola no so ani je bo so pa into sa bia no so astrotef no so eda no at the school be any sa Roman school any Anglican any Presby school e wa na wo nti san kola ni nyina betimi abebo so na be ya sa U15 ne sa U17 no nyina na betimi anya sa talent nyina e wo ho na wo kire mu no wo say contractor no enko ba bia wo haya nti skani nya ba ya wo ka kire sa wi so mabunu say enkodru afi wa awie ye no na say astrotef no so afa no ntuma pa aiden afra na nsem a ya nkasa ye wura MC for sa wi so ye wura Dominic Jesse as a Jesse or so edebetu dwa ematie for no nti ha na me Fredis me dey say news I mean newspaper review no front page no me dey ebesie nti boss back to you
newspaper front page in there come you tell when no say me na twetwe nkomo concerning the project or any supporter or the boy Western of young ladies supporter or the boy more obi kusi skills sometimes nipa person no keeping your skills no especially no leading person about creative about your money creative industry now
Western na work be na so be quiet municipality until further notice according to regional chairman Benjamin Ama and the betubia say until say regional electoral committee no ebe resolve these issues ni na wie no say see obi oye campaign obi oye den obi hold on until further notice until after say committee ni be hia no na omumu say problem we ma solve wie no and no mo san be the official date biem e ba be to ho ama sa election no sa na etie ntenye se bia ye de suspension atoso enokore officially ya suspended internal elections will be being so be quiet.
All right, that's great. I know a newspaper update by also yenim astrotef no ho asem da yesaka MC Yura Dominic Jesse e wo fidium ha no o kan asem bi concerning sports ye share o kan sports academy ho asem and also ye share o kan asem bebre say traffic light crowd juna say obo nsem bi so to say yebenya wood village land or more secure land obo niam bebre so my own share video now we call your video your reels ni mo be hu sa video na also watch the one update nti asotef no deɛ waka ho asɛm na bibia ayɛ kama sports then sports for no ɔmbɛba ne ɔmo bɛdi nkɔmmɔ na bibia akɔ yɛ nti yɛkɔ na yɛkɔdi nkɔmmɔ kakra na yɛne yɛwura maate akɔdi nkɔmmɔ kakra na bibia yɛahwɛ sɛ nkɔmmɔ no yɛbɛtumi atoa so na ansa na yɛbɛdi nkɔmmɔ no ma menkyia nkurɔfoɔ baako mmienu bi Florence Jackson wohwɛ show no nkyɛ kɛseɛ nkɔma wo paa na wabɔ mmɔden wayɛ adeɛ ankasa wohwɛ program no biribiara ɛrekɔ kamakama woyɛ yɛ #1 fan wate aseɛ Florence Jackson no nkyɛ kɛseɛ nkɔma wo ɔhema Nancy wowɔ Iraq mekyia wo Hilda also wowɔ UK nkyɛ kɛseɛ nkɔma wo Regina Takwisin mekyia wo wowɔ Watiko wo level 200 hɔ na wowɔ nso nkɔmmam na ayɛ a na wohyɛ Christabel mekyia Evelyn also mekyia sɛ biribiara bɔkɔɔ deɛ nti nea ɛwɔ hɔ no mede nkyia nkaeɛ no bɛtoa so na yɛ moving on ansa na mate bɛgye n'akonnwa na yɛde nkɔmmɔ no atoa so ba ma menkae wo sɛ Wenda ɛde online training bi ɛreba Wenda online summit na training no title ɛda training ne so ɛyɛ tax relief and your business tax relief and your business tax relief and your business harnessing tax relief for entrepreneurial success na kyerɛ sɛ wo business a wopɛ sɛ wohu biribi kakra ɛfa tax no ɔmo de program bi ɛreba na program no date ne yɛ 14 June na program no ɛbɛba so Wenda Western North din ne yɛ dɛn Western North Wenda din na mmerɛ afi no Wenda no mmerɛ afi full name no Western North Development Association because executive no ɔmo fan chairman Wenda no nti Wenda ɛde saa program no ɛreba 7 PM online Google Meet o contact sɛ ni sa time ni draw yɛde link no bɛ send ɔmo bɛ share link no in any of the Western North groups no onni bi mu a o contact yɛn that day na that's 14 June a no ɛbɛdi nkɔmmɔ na yɛahyɛ link no ma sɛnea ɛbɛyɛ also wobɛ benefit ɛnra Rutab ɛba ha ɔka the essence of business registration ne saa nneɛma no ba sɛ wohu sɛnea wobɛ manage wo tax wotwa osnet clearance ne saa nneɛma no nyinaa GRA wotwa wo tax GRA ne nyinaa no ɛbɛboa wo sɛnea ɛbɛyɛ a aban project ɛba sɛ wopam adeɛ yɛhia school ntadeɛ a kɔ na yɛakɔdi nkɔmmɔ na biribiara nea ɛwɔ hɔ no yɛde aborɔ nɛ yɛkɔ akɔdi nkɔmmɔ kakra fa health yɛmpɔmuden ho any issues related to honorable Kwabena Minta Akando nti mekɔ na me ne Mate waba studio ha ɔyɛ one of NDC regional communication officer ɔyɛ a very big person na ɔkɔ some of the group no mu na ɔhwɛ chat ɛkɔ so na kyerɛ sɛ ɔboa NDC with ɔde fact ne gu hɔ ma wo wonte aseɛ na ɔnso ne no akɔ head to head na biribiara akɔ kama nti manya no ofidie mu ha mede ne ba bɛwura mu na yɛde nkɔmmɔ no atoa so aberante ma wakɔ aba sɛ mɛtumi afra aberante
wobɛtumi afra
aberante ɔyɛ very big person nti wokɔbɔ biribi na wanka de yi a ayɛ sɛ wodi odwan aduru ahemfie no wonni asɛm wɔ hɔ koraa gye sɛ odwan no wogya no wɔ hɔ na wokɔ fie sɛ biribi akɔ bɔkɔ deɛ
biribi abɔkɔ
NDC kɔ sɛ
NDC biribiara yɛgu yɛ reorganizations no so
okay
so this year biribi yɛduru branch election
alright
and what we are doing is a nomination finally awie so we are looking at say befa forms we go to the vetting process now from when we say offer in this at the basis no and right from the branch we move to the constituency level and at the ward level we are about constituency the base no IF foundation so you go so NDC mu yaboko
by end of the year the normal year election
and by the end of the year we national we could do national then the following year no the parliamentary and presidential so that's 2020
okay and 2027 I bet the because me that time that time na amanfoɔ mo promise nneɛma no mo ntumi nyɛɛ no
ene
na asɛm ato ɔmo nti ɛno deɛ wɔ hɔ ɔmo bɔ adwuma kakraka yɛgu so ɛbɛyɛ ne dɛn but as a regional communication person ɛna mema wo yɛ introduction obi anim ate wo a wowɔ western of a wonim no na kyerɛ sɛ either sɛ wonni region mu anaasɛ wompɛ the concerns or things that's related to western north wonni region mu koraa na wowɔ whatsapp a wobɛte ne nka ɛnyɛ whatsapp koraa wonam facebook tiktok koraa wobɛte ne nka ase ase nti introduction deɛ ɛno ara na mama no ndc regional communication officer right
team member
team member team member na kyerɛ sɛ ɔkasa for the region ɛba no ndc amanyɔkuo no mu a nti yɛhwɛ as a regional communicator no yɛhwɛ ɛba ne health yɛnkɔ health sector no
okay
about the health sector now, then I'll be concerning health in general, and yet for Western North per se in general.
okay
Problem in Takando Edan.
okay me nua meche watifo
Yeah.
na ya do mo asese brano bia no moje reti odumadi no because we news there we are one of the media stations more project the region baba wan baso oba the health the me can say NDC yeah yi Western North mu
Okay.
because don't say yeah chiche cabinet positions one of the positions I the Western North the health minister and the health ministry and I the minister no so about Ukruma sabi obi anu ode ne sabi nko be kire ne kru nti anya hwe kra no the region no will get something out of it nti wo hwe a minister baaye no there are some of the things odi agu akwan mu me start wo osoro na me
Okay.
abewie in the region because in as much as say oye health minister de ma Ghana no ofi Western of your so health minister de ma mine
Yeah.
wo hwe a ye baaye no na you will be a friend of national health insurance scheme national health insurance authority and when him say national health insurance scheme you know yes see achi ba bia edema obi a obeyare obekọ hospital with some specific yare bi enti ye ba no na e car na da ho nti no hospital so de omo claims no ukọ hospital na ye ma wadura ye nji uska no makọ jiska no amayo nti omo de omo claims ne kọ national health insurance authority a NHIS was say aban en release iska mai nti ano no sa no so edu ba bi ma ukọ hospital kran sa uka ukura insurance ya na hospital for one person make sure and here by no what we did ne say under the auspices of honorable Kwabena Mitakando it meet tuya e kano 2.6 billion Ghana cedis ya clear sa debt and then no ka say NHIS ejina in fact ye hu say ukọ probi say Uruguay na ukọ probi say Uruguay or South America offers our country now access to healthcare e free the man ubia nti ye pese ya achieve bibi e fe universal health campaign e Ghana ebetimi achieve ya na one ade e fe no national health insurance scheme no o see make sure say omo enroll wo so no numbers na be ko nanim that is obia opeso enroll wo so bia benya ho kwan bibia ni wa ensi ni kwan say like bibia ni we be si ni kwan say nipa no nye den ntimi enroll nso ye ba no through the initiative of honorable Kwabena Mitakando as health minister etimi apaja universal health coverage no under national health insurance could be 65%. Nti na ofa Ghana for 65% either NHIS so based on the national health insurance scheme and authority or data. So looking at this, we can say national health insurance authority and then the insurance scheme no, things has been so good. Number 2, say where Ghana ha you say so do na say we call hospital insurance be foul e bia we tia we ya we need to brew hospital insurance be there be fa. Have you asked yourself about ubinya cancer ubi yekoye obi surgery
Okay.
sa nipa no so ono so ye Ghana ni he deserves say aban sika wo so de ma amanfo no mo sesa wo ya he also deserve the same thing nti in opposition time na ye campaign no ene ye kan say ye buy the be friend of Ghana Medical Trust Fund you trying to friend of Mahama the botaya na tell ni say I see make sure say obi bia o yare a ne bo den kidney dialysis cancer surgery ne sa yare akese no nipa yare na so ko hospital ya nka say because of a caninti no ya nsa nipa na yare because nipa no nso no ono nso o se ne ho to no Go him says Ghana, as ye na ya toye. Near sorry, United to be Juma. We contribute to the GDP of the country. But just what I said. Under the leadership of Honorable Kablan Kandon. It's me release our initiative last year. I did bill called Parliament pass it. I mean, no, initiative near medical pilot. Emma, if your first 50 what cases. But just what I say, first 50 cases are, you know, it be quite free Western of regional. Much more Muska be 70,000. And I will say, may there be American say since independence, and since the Fourth Republic, we seen it. One of the biggest social interventions in Ghana is IDP. We be the Ghana Medical Trust Fund. We be compare free SHS, but the American said, where Ghana
free SHS, their education.
Yes, make kind of social intervention in general. Where Ghana Medical Trust Fund, a friend Mahama case now. Where free SHS are buying less than 1,000 cedis per child. That's what I say. But Ghana Medical Trust Fund are buying to be 70,000 per 1%, depending on the panel. They are ready. You get a lady here, no Western offer, you're picking up as part of the pilot cases. Sadly, they do not, or will be now cancer in the bone, their friend leukemia.
Yeah.
Until Yari Nane, Ubeso, Yapasa San Yari, not making 800 billion good cities. Ghana Medical Trust Fund. So looking at say paying 80,000 for one beneficiary, it is something that is so monumental. And also, one of the can drive here, my yes, be a headache, my year pass. Now you flew on your back and say, okay, so you clone Kumama. You say, oh, Yaria, now call hospital, Utia, ya, malaria, NHI. Now, what do you want to say? We've been to checking the BP, or checking the pressure, or checking the sugar level. And also, I want someone to say, into I don't know, you be a friend of free primary health care, then a buy. I don't know, in Krum Kumama, and you be a lady because as we Krum Kumanuma, sir, access to health care, no, and a very big problem. Into another free primary health care initiative, no, the boots, beba, the best establishing some boots be. Utibi ya oya oni so bi chiniwa obetimi aden akọ na anwa ato eno nso no under the leadership of Honorable Kabina Mita which me ehwe maye den here enrollee afi nso no that is for the nation. Now when him said the last time aban hospitals aban yi sika ekoto mfidie ebegu hospitals no was way back 2014. Yes, since then there hasn't been any. No, a woman hospital be ankasa to made in the IGF. Ekoto machine biba. But say aban ankasa yiska. E won the conference say me yiska na hospitals e Ghana ya aban hospitals. My real truly was way back 2014. And at the leadership of Honorable Kabina Mita account of 2026, aban yi 500 million Ghana cedis a makoto mfidiaba. Ah, match first fees. First fees no say we also government hospital nya. Assign so government hospital nya. Only say me kind of government hospital. Yeah. Because we work as an Asafo and yet part of the government hospital. Okay. But Asafo is under Christian Health Association of Ghana Chart. That's what I say. You also nya as there was sign so kwam ho no so nya da contomra mu nya. You get it. Yeah. So looking at this initiative no, it was all spearheaded by Yangasa Yenua and as your brother Honorable Kabina Mita wow Western of it. Okay. Now you free one so you create the newly 6 regions no. Now you want to say region be anya regional hospital. Okay. But you share your home then as aban no. Na this year 2026 you bet me simians. Nti sa miensa no sabe minister ne fie kro mu nti no yanso yenya benefit. Eno nti no we the newly created regions na under the leadership of Honorable Kabina Mita Akando. You see regional hospitals all the newly created regions. Okay. But that's what I say. Okay. And I think so another thing so yeah nursing colleges. But that's what I say. Access to healthcare. Say ubema ubi apomodin papa no. Also ultimate training nipa obema sa nipa no yare no apomodin papa. But that's what I say. Nti every truly hospitals. Yeah, they Ghana Medical Trust Fund eba. Yeah, they free primary healthcare eba no. See any officers na ombe undertake ombe administer sa policies na me achieve but that's what I say. And you know, under the leadership of Honorable Kabina Mita Akando, by now say this year, I'm basically 8 nursing colleges across the country. Western of Yedia no or Jabuso. Ufi Jabuso Quanta, Echo Jabuso Kuma, when Sabin Kumso, or Master or Sunny Fanso rather, Master AC, you know what contract or site or yeah. But just what yes or site as we speak or yeah. Now ufi hwa na wako ye buy no you say the previous administration MPP abuy for nurses 13,500
for the whole 8 years.
No, for 2024 for 2020 batch but for 2024.
Okay.
But that's what I say. 13,500. So 13,500 we now because no we didn't payroll no so. But that's what I say. Under the leadership of Honorable Kwabena Minta Kando as health minister no. Obo modern MIA timi sa nurses when you timi di omo echo payroll no so. Me no ka say omo je salary. Salary arrears na itwa mu no kwa no mama omo say last month omo tua 4 months. This month omo tua another 4 months. Na nkaka by the time we be do July no. Na so omo clear arrears ni dey full. Na the subsequent month omo timi so aye. Now ohwe schools me no a training teacher for the nurse for Ghana. This is a teacher for the no omo run a degree across all the 46 colleges of education in Ghana. But just what I say. Now we nurses for the now because we because we degree nurse this is nipa ko university. Yeah. And also go university now posting so about yourself. But just what I say. So under the leadership of Honorable Kwabena Minta Kando, what he is doing is was selecting nursing trainings, you know, yeah, say obey more money now awarded degree. There are some specific courses I'm awarding degree. Okay. But yeah, but just what I say, we take it face by face. I'm not gonna say Western of region, school you choose College of Health or Asafo. And also yes, and also you choose courses schools now they will be awarding a degree under the nursing training initiative. Okay. Now, honorable buy, and who say, okay, teachers are which makes radia no akwaji study leave, no akwa university. So okura diploma no akwa degree. Yeah. But that's what I say. We nurses now, say nurse ni bi ebenya study leave akosua ade no. Ya na problem. Ti nurses for no bebre na distance. Bebre na distance no mo ye den. Omo ye. But that's what I say. Nti honorable buy no under the leadership of Honorable Kwabena Minta Kando no. Oba dey why ni say sa nurses ne sa principals no was sponsor bebre na so mo nkwa aburuchire enko better wonali. No mo fa ben contribute to enka what we already have in the county. But that's what I say. Now we no free one so honorable buy who say unemployment rate among the health professionals a very big problem. But that's what I say. Over a year, you can say allied health professionals are personal you can say physician assistant can home. These are medical laboratory scientists, nutritionists, and the last time I buy a major recruitment was 2019. Since 2019 up to date, up to 2024, now you far allied health in Ibia under the leadership of Honorable Kwabena Minta Kando. I think they can topics no. But I'm also chipping in as part of the achievement that Honorable has guided. I may achieve. Same applies to nurses. Okay. Nurses in the last batch I fire was 2020 batch. This I know because of Honorable Kwabena Minta Kando. Yeah, fast uncle for now. Yeah, person money na no be boa na health sector. Yeah, so name me boss in na here. The Honorable Kwabena Minta Kando as health minister, which me achieve the amount of mine no in the space of 1 year 6 months a body ding man be health minister. Do be say understand.
All right, that's great. Nyaman they were listed be na say honorable or born home modern, but answer na e be rank money mu ankasa no. Yen share a ban health challenge Western North. And then one of your major health challenge ha.
Yo.
Western North. Yen share a ban because you better to Confanoche teaching hospital side but yen share one of the major issue and health related issue I facing your region Western North because while it's still from top, when you say Mahama Kesse trust fund anyway you best started from the bigger cities and Sana Aba. So is the focus on the rural communities.
Okay, and
if you challenge you
okay and seminar will be saying I think you wanted us to come to our region.
Yes.
The challenges and then what we have done so far. Debi America say amamu yebuyi and then governance brofo and twi ya amamu no.
Yeah.
Ni nyina ne say you solve problem. But that's what I say.
Yeah.
Nti ye buy no ade ba ko a honorable hu ye ne say you see me say honorable kwabena mi ta kan do adwen a ene nyansa nyankopon de adom papa no etwa edutwa mu because he ohun say nurses no bebre na ekrum bebre na ekrum bebre na ekrum but we rural areas na eya na akoye problem nti oba yan say recruitment a oyi a obefa nurses 16,000 that nurses 16,000 emu 12,000 e ko rural area nti we regions bi say western of ye quota yenyae e dozen say the Ashanti region nyae but so I say number of days no kwa no the application western of yenya 2 days Ashanti region greater Accra munya 1 day eastern region munya 1 day but so what the mechanism so our focus is on the rural areas now say you person you bridging the gap between rural areas no and then the urban areas now
Okay.
rural urban areas say say anya hwe kura na your private hospitals or how be betimi akwa dey akwa access
Yes.
but so what I say but you talk about the rural areas now how about that no Oko your district assembly common fund no ma. You say under the district assembly common fund no. Yenyi percentage emphasis chips compound wo rural area be a omuni chips compound. But just what I say, and no a Ministry of Health and a Ministry of Local Government and I can't boom on yes initiative. That is number 1. Number 2, baby emphasis say you see the also district municipal assembly. You see chips compound was sevi kujina is sankru. But that's what I say. Say you see people kojina isankruma. What about omo sui? Omo you can say nkonya, omo abwaji krum, omo bechewa, omo 81 that's our catchment areas. Omo so how are they going to benefit from that initiative? Wa bra yem fa bi nkoji yen twen say yen kosi wa na ansa no mo so timi access ya na. No. What we are doing is that under this free primary healthcare initiative, that boot na the other no. And the people those areas no. Near deploy health professionals no e dey mark those areas no mark boa undertake the healthcare improvement or now who is our question be say what are the challenges challenges no has to do with infrastructure that's what I say there is a big infrastructure gap because looking at a bigger hospital I work western of region no the first one here baby you also be any government hospital come to you also government hospital who just assign so but what I say, although say you get some health centers and chips compound, but we needed big hospitals. But under the initiative of Honorable Kwabena, we are looking at say there is a boot in the augment here. At least we can, if we can solve all crana, we can as well do something for the region to also say regional basement. Two besides sanity. In fact, there are challenges. We admit there are challenges in the region with regards to health, but we are doing our best to make sure say I bridge the gap. That's it.
All right. That's great. First, you identify the challenge within the region. Before say you better because Western North, maybe say yeah, part of your last discussion concerning this topic and so the issue going on within the national level.
Okay.
Confanochen Teaching Hospital. It should be about concerning suspension of the CEO of Anoche Teaching Hospital.
Sure.
Yura Dr. Pekwesi Bedu. Suspension by make kind press release from Ministry of Health, my kind press release from Anoche Teaching Hospital. Looking at it, demonstration be any demonstration strike be so by my doctors for workers maybe echo strike for 3 days. People were not having access to healthcare. That issue is disturbing. Me and my hospital, so I know the essence of these things and the impact, negative impact a big or more access to care. No. One way or the other, yeah, taxpayers' money, and I treat these people, yeah, treat moka. Then at the end of the day, you suspend the CEO being, what doctor near yeah, taxpaying money, yeah, treat our you decide not to go to work. Until now, I share all the media coverage across. So now a single doctor can point out say BBC in a man to me yeah strike but the focus is because of the suspension of CEO and tax paying money and the edition say wa breaching directive. Over me my update based on yes suspended no.
Yes, and okay, on the 27th of February this year.
Yeah.
And President Mahama make a pronouncement.
Okay.
So regardless of what is happening in any of the government hospitals. And once a patient be coffee because say you need bed. That's what I say. It is a nipa neba. Na say because we go one yare na obeba no. Say the infusion sin so kra na he will be okay. That's what I say. Akunwa mu kra na odi nipa na betena. Nipa na tena. Na man pane. Na nipa no ho nto no kakra. No nto no kakra obetime pagya na de hye no. E de na ko nearby facility. Ama no why dey atop. This was a communique from the presidency. Undated on the 27th February this year. And the president make his happen. Now, president and make that pronouncement. Now, president is supervising ministers in our Ghana. Ministers also supervises subsidiary agencies under them. One of the agencies in a Confanotic hospital. That's what I say. That agency is under Ministry of Health. Why not? Okay, Ministry of Health. Honorable Kwabena Minta. The Honorable Kwabena Minta Kanda all year will ministry want to say, or make sure say president need trim for in a dream for about the health sector now. Which may execute successfully. Okay. That's what I say. Yeah. And when the president ama order say, obi obeba hospital biano, regardless of nipa situation, may anka say mpanipo. And see nipa no nkofie enkonko. That's what I say. Because hospital na ya ban there. Say form cry am nipa no nto because say ooh. Na say say do beto form. Kura na the infusion yesi so mo ho atowa. Obe pene say am to form. Dan so be kofie akwako. That's what I say. The president issues are directive. Na CEO of a bigger hospital like Confano teaching hospital. No, it may issue directive without consulting the board, without consulting the minister. No issue directive say a why ma new So as a minister, now person execute what the government want to do about the health. What do you think the minister will do? And the minister na minister not suspended because of that decision I will take here. The reason is you see in the health sector. If you don't get somebody and need a dim and manage health sector now, the SC won't say na see what Confanochi, na be see what Kolebu, na be see what Tamale. Won't say recently, car ball one kwabena misabi, onya car accident. Okay. Emma, I think Kolebu teaching hospital or something. One of the hospitals were Aban hospital. Yeah, they didn't do what they catch and say, Omufani Kofi. Engineer. No. Yes. Okay. Bed in the yeah. And a nipa uwu. Yeah. Emma sa guy no kwano ni nua o medical doctor asi hospital no you see hospital na e aban hospital one we try judgment dem anya aban yeah but so what they make tax paying money yes so should we be doing this to ourselves and when na honorable Kwabena Minta Kano gina so dey suspend the CEO no now in fact you see health workers ni bi no ye be sro say they are there for us yem so ye wo ho dem omo say be see ni ho a school no ma course on ba be ehwe yare no emfaso se emfaso bi amaso me ba so at say so no mo so ni ho a yeso ye de ye ni ho so in as much as say ye hin omo no they also need us ba so at say okay akosombo tama akosombo hye na CEO ya mpamo no ye yi na di ye yi si what is say grid co staff bi so okọ demonstrate okọ strike because of say ye yi CEO aban na di ni CEO na aban no anka me ba ho Dr. Kesse, yeah, appointed no from more previous government. Yeah, NDC they appointed no. Okay, that means yenim. Say NDC appointed to leader. That means you also believe the concept of the party. Oh, it's not necessarily. Oh, we have an example. I made in our society. You see, this President Mahama administration. Okay. Everybody who has an ideology so be manage or be embodying under the reset agenda. So anybody we don't because we Ghana airport company lady no or your ba mu CEO no your ba MPP time they appointed no omu nyi na the other so you CEO oko forestry commission CEO no always say no omu appointed under MPP administration he is still the CEO today oko minerals commissioner CEO no omu appointed MPP time but as you CEO ne maybe I just want to say the make okay I have given you a series of examples so it tells you say the reset agenda no say what you say now say you are ready to abide by the reset agenda you give the opportunity to try but in any case CEO no I'm not disputing the fact say on your NDC I'm not disputing the fact like that but what I'm saying is say the suspension was in line with say or president initiative no and as a president directive no so was there a communication gap because yes there was a communication gap between CEO no the board and a ministry no but that is not
on the problem no didn't have to do with ministry no and as a board no. But that's what I say because sometimes I all take a decision no and I consult a board no and as a consulting minister no, I'm sure there would have been a provision. But he issued the instruction just like that when inform me will be high. But that's what they make. So looking at that, not as Dennis said, you are not abiding by the president's research agenda. But that's what they make.
Okay.
So looking at that, then I'm move as well they suspending. As we speak, I'm not calling off the strike, because Monday board any suspended CEO minister CEO need you to say
okay.
He shouldn't have say president need directive no be there on go by the president directive to wanyade. So there was a jojo from there minister Emma Ashanti regional minister also a medical doctor.
Okay.
Medical community na work on. He spoke with them. Subsequently Otumfuo said to so by and then Abba say they will have to work for the betterment of people.
Concerning that, make information online say because of Otumfuo internet they are going back to the office to work. And because of Otumfuo, that's why they are going back to work. That means I don't even see the essence of respect between even Confanoche Teaching Hospital all the way to the Ministry of Health. I say,
you see, you see, the TNSA, they are not going back. The truth of the matter is they are not going back because of Otumfuo. Let me put it like this.
Okay.
Otumfuo Ashanti Hene or your Hene Ghana. I think that or you're one of the most respected chiefs in Ghana. Me, I really admire the man because of also Hene be over. Assembly no can be somebody in the from. You will not see Otumfuo like that. He is a man. Some of us, if you look at the dignity what possesses over the years now, or a fantastic man. But just what it American or a fantastic king. American say, or your Hene be respect. But Otumfuo doesn't pay here to work. But what I said, nurses for them call striking. But some said they are going to draw their salary. It's not Manchia that pays them. But that's what I said. 7. So move job pay a Ministry of Health, Ministry of Finance, any abino, any triasa workers. But that's what they make. So you think say Nana Otumfuo will go and speak to those health professionals without the intelligence of the health minister? There has been some communication backdoor. Because of that, and I call it off the strike. So yes, Otumfuo bam, but the minister also played a role in ensuring say I call it off the strike.
Okay, Ama Roxanne, or say excellent submission from my esteemed communicator, Comrade Emmanuel Mati, the whose voice is really low. Not just say I saw me bobbies, and then many but my calm kakra. Not just say me because head the idea we don't need to be deprived from. Idea we all need to because may can we not because that issue is not related to Western North. Imagine say what you be assigned to government hospital. Doctors for say refer no enko Confanoche no be drew on you say nurse ne doctors all strike. Why are suspended CU? I don't see the sense of it. Now all doctor any nurse need a suspension of CEO my management in dealing with it and how the on because appointment I don't think doctors and nurses were there to appoint him. So it's not like I support that, but I don't think it's right. Say you be deny citizens their right to have access to healthcare, and it's very bad.
And then, there is one misconception here I want to clear. With regards to Honorable Kwame Nkrumah, there are some and they are moving around and say, Honorable Kwame Nkrumah doesn't deserve to be the health minister because of on medical. You see,
interesting.
This kind of saying communicating and particularly from the side of the MPP, it is neither here nor there because Honorable Kwame Nkrumah, I am a ranking member on the health committee in Parliament 80. That's what I say. Over the health sector now. Agencies I work under health sector 30. I'll give you some of them. The bigger one is Ghana Health Service, National Health Insurance Authority, Food and Drugs Authority, Health Facilities Regulatory Agency, National Ambulance Service, Mental Health Authority, Medical and Dental Council, Ghana Registered Nurses and Midwifery Council. They are all under the health sector. If you're always a medical doctor, you have a knowledge on the medical field. What will be your knowledge on National Health Insurance Authority? So you're a nurse senior, you have a knowledge about what nurses practice. But what will be your knowledge about National Ambulance Service? What they do over there? If I just want to the mechanism.
Yeah.
But you being a ranking member on the health committee in Parliament, because a health committee, all these agencies are under the health committee. You get an oversight knowledge about what goes on in this agency. That's what I say. And at this one, I can say, why you ranking member? You can say ranking member, opposition, no committee. You can say health committee, no opposition. No, or your leader or sa committee, no.
Okay.
But that's what I say. Honorable Cabinet can handle our position for fear poly from 2017 to 2024. Into about the health sector and a man winning. So if we are looking for somebody who obey a perfect health minister, is he not the one? I was say the man. The American also what I say. And then let's not forget, say, even if we are to compare, maybe say the previous health minister, what position men on handle related to health and son of a health minister. He was just a chartered accountant. Not a chartered accountant. He didn't do anything related to health. And so be a health minister. That's what I say. Unlike Honorable Cabinet Minister, one manage the ranking member for health for 8 good years as we speak. So looking at that, I would say I wanted to clear that misconception. Say Honorable Cabinet Minister is fit and is diligent to handle the position as health minister. And then in fact, over the 1 year, in the last 1 year and then 6 months now, truly you can attest to the fact that he's one of the best ministers, health minister Ghana in so many years. And that's it.
Okay, that's great. Honorable Minta Kando or Bojuma or try say obe build up your health sector no na asem we me pese meka me pese meka because meka asem foforo ebeba ye share agenda 111 project. Okay, who the life of such project within anya kra me you say be 3 kra Ashanti region. Okay, our project make sure era Franka mo akonhene ni videos some of the projects on Marco Clear Land. Mahu say minority or more ranking member for health. Almost akwaje sekan odo ehoni afari you Mahu say odo mahu say city for post odo ankasa or say odo ho se ne be ya mbebie for operation to limit the way the bed in that Confanoche teaching hospital. So what's NDC doing about this agenda 111? Do you even have some in Western North?
Yes, we have some in Western North.
What's NDC doing about it?
Okay,
that project.
I made that say. I'm not sure what you for. Oh yeah, agenda 111 hospital. Hospital will come once. After military hospital. I know you the Eurojet. You could schedule Eurojet. Europe for and a brace scabi. It was classified under Eurojet project. And the years our hospitals. NDC is serious 2016. Now I can say you didn't forgive a commission. MPP in 8 years, and then they have the gut to go there to portray say they care about what happened. Now, hospital.
But is that the reason why they were limited from accessing the facility?
No, the facility near military for facility.
Okay.
They can what I say. Okay. Afari military hospital. Soldier for hospital. Okay. They can what I say. And a hospital no. Near man hospital equipment, but air conditions you fix it. Meters power substation here there. So they are there to make sure that somebody will not come from outside to come and take the things. They can what I say. Don't forget, say hospital near soldier for hospital. But what I say. Okay. So no, and a soldier for the way they do their things. No, we MP. It doesn't mean that you can stand up one day and go to soldier camps or baby inspection. You need to give them notice. They can what I say. But you see, nobody should prevent a citizen of Ghana from accessing a country's facility. Yeah. But so a course also quickly and they communicate when say they have the right to inspect them. Okay. Even though it's abandoned, they should just assess the project and then about the agenda 111 no. Over Western North, you will be or Adabukuru.
Okay.
Adabukuru be or so free Adabukuru airco aquabia or quanoso. A quiet fast call a half no. Yes, it was a quan. Afuwe abaya and say you better complete 10 of the agenda 111
across the country.
Across the country.
Western of Senior.
Western of no, you will 2. Babaku ye a contomna government hospital no redevelopment ye and there were Adabukuru no. So what we are doing is we have completed 10 of them. Adabukuru the other home. But that's what I say na other 9. So I say so we are looking at say by for every year if we are able to complete 10. And by the time I be here 4 years no. Now at least I have 40 of them there. Nyame ya money it my day. In fact, this a year American year in the 2026 budget. I captured what 2026 budget. Okay. And then the reason here I can't 10 no, somebody may say 10, is it feasible? Yes, so we are agenda 111 now. It be through some stages, it be a 90%, it be a 80, it be crown as a snuff, your intimate foundation. So those ones in there will come and tackle that because priority first. Yeah. The akaka crami you know, we think say a contractual renegotiation and then equipment out the you complete the project. That's what I say. Yeah. In as much as you can say, one thing we will see is agenda 111 was not planned because initially they told us they would build 88 hospitals. We don't know what came about. So basically 111.
111, yeah.
But so you see the difference between this agenda 111 project and the 24-hour economy market na yes in say agenda 111 wait me only na social media what who say you see the oil revenue sinking fund consolidated fund this is assembly common fund the DC I didn't see a DC. What was the dedicated fund? And as you see the World Bank was DC, there was nothing like that. Them can watch I say. But if you compare it to the 24-hour economy market now, because I've seen people comparing the two, the difference is wide. If you compare to the 24-hour economy market now, in the 24-hour economy market, there is a dedicated funding, which is 25% of the district assembly common fund. Them can watch I say. So 1 year you get 100% to start the project. First quarter you get 25. Second quarter you get 25, 50. Third quarter you get 25. Fourth quarter you get 25. Then can what I say. Yeah. So if they ask you say 24-hour economy market, what is the source of funding? It's from the district assembly common fund. Yeah. But what's the source of funding for agenda 111? I don't know. There was none because the project was not planned. It was just built to sway people to vote. Then can what I say. Okay. So that is that. Okay. So the question I will be saying, we are committed in completing them. All right. And then 10 of them will be completed this year. So that it will be operational for people to access it. One of them, no, Asare Military Hospital, so we are in that trade, in the Ashanti region, and one Kobase, and Western of so you will be Wadabuku. We hope that they will all be completed and then the citizens will have access.
All right, that's great. Yeah, sure. Western of Abano Health incident where I see or confirmation is a matter of accident and emergency unit. You didn't say moto pragiani moto fui. Among jai moto I did agroness and emergency seba Western of your facility maybe.
Your meaning I made a CBM. Western of you will be.
Okay.
Yes, Uko serious government hospital. And all 4 people now a diner walk right no.
Break up there
no. You see, I'm coming there. I'm coming there. Oto over unsa nifansoa.
Okay.
I think there is some name be accident and emergency unit. Yeah. A private man be the BC. Okay. But you see, in the healthcare delivery, no, corporate bodies, social responsibility also more 7 news, more responsibility. The last time you say more yes, I'm U15. I have forgotten the
football project.
Yes, football project. Okay. It is part of your social responsibility. Maybe a revenue amunya. More than some 10% to be so that you can also at least your small way you can generate something. Right. Papa no coach is you need to know. I'm sure he's an entrepreneur in Western of Region. Yeah. So he's an entrepreneur when you start from Western of Region. As part of his social responsibility, to say I'll go and build accident and emergency in the man. Okay. Baby answer. Oh sure. If you want to I'll call Asafo. Asafo is Christian Health Association of Ghana. but Ministry of Health regulated because you post nurses and you post because.
All right.
Remember what I say?
Yeah.
Omoye NHIS accredited. Yeah,
Okay.
what I say. They also have accident and emergency unit. I don't know that of Asare so and then BBN. But what I can say is we also is having Asafo is having, and then Akontomra 2 is having, and I think Gabosu 2 is having. But that's what I say. But just that you see, if you compare the accident and emergency unit at war, Gabosu, until found to the outcome for nothing.
Okay.
But that's what I say.
Okay.
You catch your coat according to the cloth that you.
Mhm.
But that's what I say. Yeah, near we have gotten.
Are we seeing that in the new regional hospital now, Ebano? Because the
Minya,
issue. Ansana
Okay.
ansana obeka say unchama no. Yenhwe even the market nemo ye the 24-hour market na waka ho asem no. Based on some of market site some of the plans I've seen no, I'm not seeing a huge market structure like the one we see in Kumasi because western of ye di Japan me pesa me call 24-hour market name but me pesa me in relation to regional hospitals
na
na
BC
because enye regional hospital ye big to say e be a comfort not e be ye nya ne sa but enye big structure na be say we also government hospitals
yeah ma me ade 2x4 bi amfansi ya we had a 24-hour economy every 24-hour economy market 18 or 261 districts across the country no.
Okay.
There is a clinic facility.
Yeah.
But that's what I can say. Now you find on Tonche. Now the regional hospital no. The regional hospital is an ultra modern regional hospital like AC.
word no enemy stretching ultra
You
modern
see,
no.
ultra modern now make want some in a sense of say
Okay.
the regional hospital will get an accident and emergency unit. But that's what I say. It will get an intensive care unit, ICU. But that's what I say. And no the main two never become an iron modern. No. We hear no few there are some basic things that we see hospital be out the BBC lab,
Yeah.
pharmacy, males and females ward, children's ward.
Yeah.
But that's what I say. And maybe people can add maternity.
Yeah.
Baby a man be but that's what I say. Surgical ward. Baby a man for operation. Offices, account office, what
administrative aspect.
yes, obi su kwa be kan say yemfa mortuary requirement dem account. Yes, they are all part of this regional hospital initiative now. Contractor kwa research. In fact, regional hospital no ya there health minister through aban no ne His Excellency John Dramani Mahama can say hospitals are we can say we should go and then do re-expansion. That's what I say. We are building the hospital in such a way expansion it will be after say your population a double and as I triple. The American what I say. Okay. So that is what we are doing as a 2x4 hospital near BBC. A regional hospital. And a regional hospital no, it should be a referral unit. The American what I say.
Okay.
For all the hospitals around. And he said hospital a referral unit. Now, idea was a government hospital. It be needs our hospital. It be sitting a referral unit. The American what I say. So it will be a referral unit because of say a referral unit in internal. There was a government hospital. We have to get an upgrade in that hospital. That is what we are doing. So come to you. Every time I NDC be free abam and I say every time I 4 years and beso. You be Ghana for person so akwato ababi no. You see improvement and a significance in that hospital. And then the difference between NDC way and NDC be some years ago, they say, and Aban be some years ago, they say, BBBR we are doing, you know, we have a dedicated funding to it. Over project, no, young scar, young call home. Okay. The American what I say. Immediately I be call home. Now we are doing it. In fact, big push here, scar regional hospital here from the budgetary allocation. Yeah. But what 24-hour economic market from the 25% of the district assembly common fund. So bringing everything in, it tells you say, and before say we undertake a project, we have a source of funding to undertake that.
All right, that's great. Bano NDC in a hospital, they are very good. Bano because hospital they almost count more than more evidence. Ridge Hospital.
And Ridge require University of Ghana Medical Center.
Yes. And our musiba kumbi susi dodo wa kwana.
Yes.
Me who that hospital.
I want to acquire lunch in free primary health care. I want to acquire lunch.
Yes. Ma ya koye donation bi was our hospital na me room no o yare kra room a ho beto. I say we dey nye for advertising.
Oh, but
who the thing na who project na you should you like it say and no be and I see as regional hospital or Western of I think I'll be so happy to see the end of that project. But I'll say contract acquisition site. Where are we building the regional hospital?
Okay, regional hospital you see no ufi assign so ko dwabo so a ifre bi benchmark kwanta. But just what I say.
Okay.
Ehona you see regional hospital.
That's in which district?
Dwaboso district.
Dwaboso district. Is it because Honorable Akando is from?
No, it's not because Honorable Akando. I'll give you example.
Okay, example.
Ghana Medical Trust Fund.
Okay.
Mahama Kesse.
All right.
Hospitals are yes selected. Yes selected. You bet me undertake those. When say immediately I be selected hospital. No say hospital we. Hey baby, a Ghana Medical Trust Fund. No.
Okay.
You be undertake that initiative. No worry. The hospital will benefit from we truly. Equipment be back. You will see cath lab.
Yeah, cath lab. Yeah.
But that's what I say. Say hospital will be able
Mm-hmm.
Government hospital will be able to. But honorable comment I can see em family we also government hospital.
Yeah, for them cath lab name.
No, sir, Ghana Medical Trust Fund no.
Okay.
Once you a specialized hospital. No. They health professionals be ba ho a. No. Say before say you wait me undertake sir, wait me nya sir benefit ni bi no.
Okay.
This a doctor was a facility ni and be me access so the hospital the letterhead I then actual. I was saying a regional hospital, but because we are not having a regional hospital yet, we are using the serious government hospital. That's what we undertake that initiative. It means the serious government hospital will get a cath lab, will get an ultra modern ICU. That's what I say. And I maybe say, so we say, or your health minister Antina, or they could be aboswa. Adentina say initiative we and one fan could also government hospital. Or they bas serious government hospital.
But all kasa say. No say famra.
Yes.
Just because they are building the regional
No,
hospital.
not just because they are building the regional hospital at that place, but because of say, if we want to develop the regional,
okay,
it should be canvas. I will say a spread. The American what you say. Now let me answer your question as to why the hospital went to Dwaboso Benjamin Kwanta.
Alright.
And yet there is a difference between Dwaboso Kwanta and a Benjamin Kwanta. What I'm talking about is Benjamin Kwanta is in Dwaboso district.
Okay.
Now that Dwaboso district no, maybe I work in Dwaboso district no. The distance between that area no, this will be also. It's just some 15 minutes walk. Obi onim obi abe test. But what barrier, maybe a police barrier no one. What do 7 years? I assign so.
All right.
But just what they make an say. Now, okay, baby, I want no. Now compare that to we travel. And if we assume say omo BBN no. Moving from BBN to Dwaboso Benjamin Kwanta. Any moving from BBN to Kumasi no. There in short.
From BBN to Kumasi.
Yes, from until we assume say omo BBN there.
Alright.
If in case of anything, the referral point will be Kumasi.
Okay.
Either Afari, so we are trader or Confanochi. But just what it is. Now, yeah, you also know. Ufi BBN, the next municipal will be do the yours. Now, yeah, you also know. Traveling from yours because hospital no Benjamin Kwanta, it said they were assigned so now because from assigned to you can't say baby a hospital no you can see no. Ukraka is just less than 10 minutes we do. Meaning say we need area na America na. Because if you are moving from yes, but 5 to 10 minutes we do.
Okay.
Because we moving from assigned so I can't also yeah. The American what I say. So moving from yours so to that end you know. We be acha 30 minutes we do. The American what I say. Now look at somebody coming from Enchi.
Okay.
Here the regional hospital see you also. Look at somebody coming from Enchi. Is it balanced?
So that means we are targeting the center of Western.
Yes, we are targeting the center of Western of region. And there is a lot of reasons, and I will explain it to you. But we are the center of the region. And I believe say you also. If you also. I believe say we talk about the district that connects a lot of districts in the region. Why? Let me show you. Which na Dwaboso ofa baby amo park na wona. Oh, na so ofa ferry kwan no so a who call him good. Direct opposite. Ebe ne pa.
That's a municipal office road no.
Oh no, any municipal office road no. Ofa baby amo park na wona. Baby omo pitch no no. Utra district assembly ni kakra bi a junction bi da offer sa junction no so a e kwan na da ho no. Akọ baby omo park. Dem kan say ufi yo kakra bi pe no wura body district. That is number 1. Now offer Udru district assembly that's what we straight. Eko anim. Ebi omo no NHIS no wono bia honorable government aka no kosi ICT lab no.
Yes.
Offer hope o ko dade so. O ko so ama dade so. Now so who san wachi. Na so be fa radio rainbow anim ho. Sa ko fa be bia VIP station no no.
Okay.
Etwam a ko dwa so kwanta. 1 obeba asan so. And I said, yes, assign so ye also. Now, Chiafa the other side, now Oko Bia West and Bia East.
Just a map to all the.
Yes, so compare that to yours and see. You can't, they are directly linked to. Directly linked.
Okay.
How is yours so directly linked to body? This is who have one district. This is who have one district. And some of the other district. They can watch it. So, that area na edc no na o ma hwensi evansi abusuku evansi abusuku tia so aja se na be ma so obi fi yo so ba sa jeni no the same as obi a ofi enchi obi ofi esam obi ofi debi so obi ofi adabo kuruma eden eba dem kan what aja na there has been another misconception say adentina yaji asase e de ato yo so ha na adentina yaji asase no, you see, I am on the media with you, and so there are some certain things that
All right.
So I feel say I wouldn't even want you to.
All right.
That's
fine.
You see, I never concern say, you can't say land issue. Okay. No. We have a lot of projects to undertake in the region. You know, can say, barracks ever. I mean, military barracks or Western of region.
First specialty
yes, it's true. You see, there are some certain things we don't say it.
Okay.
But we'll get a barracks. What do you mean? You say regions are creating. First 6 regions, no. Okay. First 3 na Enya Regional Hospital, no. Another 3 na Omunya Regional Hospital. Omo the stadium.
Stadium na President promise.
Yes. And 6 regions we are changing. First 3 no Enya Hospital. Omunya Hospital Enya Stadium. Okay. After the following year, the next budget no, they are swap it. Omunya Hospital no be stadium. No more Omunya Stadium inside there. Enya Hospital. And this is the stadium. Emra Western of Regional. As I said that no. You bet me up a bia kan near the whatever stadium na person there. They can what I say. I feel I see ABC University or Western of. They can what I say. University na see about no. See a pass as it tells you as na yaji aton and say.
That means all suggest say bit me there no see university.
No, I'm not suggesting say you go see no.
Okay.
But what I'm saying is as no, we can equally use it for something beneficial. About the good people of Western of. They can what I say. So the argument say akwaji asase and what have you no. And only there we will play with them. Say asase no e na ho. E hu be ba mfaso e na bi eni akire. And one issue so has to do with say we have to develop the regional capital first before we move to other districts. In fact, again so since the seat of the regional minister what the regional capital. I didn't so say RCC. Mean kind more than 20 offices. Regional offices and subsidiary agencies regional offices. Oko RCC wa your Maslow ho, your NIP ho, your narcotics ho, your FDA ho, your Ghana Statistical Service ho, your Yoko ho, bebre offices in bebre. Nina is situated in the regional capital.
All right.
But you see, we have to also look at other districts, because immediately hospital no be ko no. Akwanya wo nyina wo se ye. Obi so to no to nsu e beto. Same as obi ti ben RCC. Na say nipa no oyo so a because of sir offices na oyo so and you also dime word. Sometimes you don't even get it. Then can what you say. So we are looking at expanding equal access to everybody across the region. That is what we are doing.
All right, equal access, but I mean support other office, either rules, the akoshe way, education share, health directorate the way. About access to it, 70 RCC. Me say the RCC lands.
You see, my mentor idea. My mentor idea. the amount for mistaking is said this is a hospital.
Okay.
I've seen a conversation amount for to say, now yeah they call they say on my report the regional minister. Omo hospital and report be a regional minister.
Okay.
Omo report my regional minister on the aside of the health, regional health directorate. I know the MP before the co-body. Them can watch I know the MP before the
I don't know
co-body.
how MP before the co-body.
Oh, but you see, that's the truth. I'm with the co-body, and I'm going to call it. It was under MPP's administration. Them can watch I say.
Okay.
So, yeah, NDC for there. Say, nanka ya de passport office ban. Sanka you bet me say passport no kwa kontomra. Them can watch I say. But passport office no we also. Ya de mineral development fund office ne ban. Sanka you bet me say yam fa nko body. But it's in the Western of region. Gaming commission office na dey buy. See nke bet me say yam fa nko bibie ni. Na yam fa nko si be kwai. I say what yours. So offices is different from hospital. Hospital offices no they manage administrative duties. They can what I say. Now, my father back on count. Says I me no can say. Me no can say. You see, yeah, commission. Ending of this month, you be commission DVL office we inchi.
Yeah, make a one seminar.
You be commission DVL office. Okay. Your ultramodern one. Said they were, you know,
ultramodern.
Yes.
Ultramodern. Somewhere, you know, ultramodern. Okay, all right, that's fine. I think say branches, you know, the mubia bebwa because bano sa nipan be drive sa ba have yes and your man be hard. Nana Abuchi Mrantehene say good delivery by Mate. Kofi confident. Say my brother is flowing very well. Say it all, bro. How can a civilian walk into a military hospital saying you are coming to do inspection whilst your government was in power for 8 years and you didn't equip the hospital? As more Kofi confident. As with your confident as Ankasa. And now NS entry say hi. NS hi to you also. Uja comment na meka mo. Nti comment about Facebook no nti yegusu a ye share ye discuss call even next recruitment 16,000 ya share a ball for this year no me time no so so nti me wura mu ho na ya share e ho nkomo no na ye hu se ne be ye share 16,000 next na enra na meetie 2026 annual health summit no na ye wura kando na o trabrofo agu na wo share some bullet and all to name say confanoche for AGB because no can about discipline a ban on health work now. But or promise or can be say within this year government employ 16,000 nurses or be recruit them into our nursing sector or our health sectors. Now already I mentioned say 8,000 already have been in the sector. Okay. No because minister next one there batches by batches. A bit more year school 2022. A bit more posting next annual man. It is 10 air with the 16,000 numbers.
Okay, Munya, the channel said, all your health workers now.
Okay.
Instead of becoming initially, no. Near my no. Free primary health care, Ghana Medical Trust Fund, then one and when you mean. The health professionals who are more executive and to be successful.
All right.
Engineer say your Fabia Juma. In fact, all nurses are the last recruitment on about nurses was nurses and midwives was 2020 batch and therefore 2024.
Okay.
Now if you were 2021 40 fee, 2022 40 fee, 2023 40 fee, and 2024 40 fee, plus 2025 almost service. So looking at that, 5 batches, which is around 70,000. You get it. Aside that, there were allied health workers are almost where they. If any word on clinical staff, so almost where they. Yes, almost a TFE. Okay. You get it. So and you can say we'll look at how many we can accommodate so that we can employ them. You get it. In last month, Health Ministry BA portal. It said 2021 batch. For no, apply. In fact, the portal was open in collaboration to number of available slots and network. But that's what they can say. Okay. In the slot near, there's all kinds of slots in 16,000. Immediately 16,000 is okay. The portal sees this working. That's what I say.
Yeah.
So some of no I apply we you be from for interview.
All right.
Now right after the interview no omo be start I engage you and then they will start working. And about the omo nso an omo system no dada no. Once me can say 13,500 bi wo ho a omo no na aban na for omo no omo ntimi ntwi omo ka.
Okay.
Together with that no and also the omo campaign no so 8,000 ya wo kan yi. A division of the 16,000. You know 16,000 ya this year. But we are looking at omo because UTA health minister say yem pese e be kwa kofo obi adwuma. Na nipa na ye adwuma 6 months na entwa neka. It is unfortunate incident.
Okay.
That's what they can say.
Okay.
So what we are doing is 16,000 omo nyina apply. But first nkofo e be di kan mo appointment letter say 8,000.
Okay.
But that's what I say. It's uncle for 8,000 will start. And then later this year, no, near the another 8,000 or so by day. I count so that by the end of the year, is 16,000 as we talked about.
Yeah, sure. The transformation this kind of employment ama community yenyi kumase ne akra ne
Yes.
sa big cities ne free. Yemra Western North.
Yes.
Ma won say honorable akando ne ki ade a na hi kra meka ne sa ene say ye be post doctor ni nurse ni to villages na nipa ne mpese obeko.
Yes.
Because no na metesa na okam bisa he wasn't okay with it. Nti oka say omo post bi mo omo anko say omo sa post another batch ama say the omo kwa serve people in the rural community. Nti what benefit is the other places? Yehwe Bia West, Bia East. Omo mo compounds on the crown. Ombenya this kind of equal share about this kind of employment na eba.
Meaning, I tell you say employment, no, the can say we are doing it with available quota I will and as available slot. Before say na ministry no be recruitment no. Omo taxi every regional health directory say omo fa vacancies are omo region mu emra. So what I say? So you submit your vacancy. Now regional health directory name number of staff chips compound I wanna say bibi any debi so cocoa clinic omo hia.
Okay.
That's what I say.
Okay.
Sa regional health directory Western North region no. Omo nim de ya kese health center I wo enchi omo hia. You know what I say?
Okay.
Omo nim the number of staff Akwabin Health Center I wo Bia East Adabukrum omo hia. But what dem can say? Enti omo dey start ayi ni beba. Omo dey ba na omo mankofo na apply which is the omo ye. Omo we interview na no ma signing nkofo to and then sir what ye health business say we no yanya reposting. Yanya post ko ya post work that is all. Dem can what I say? So based on available quota no and based on the speciality of the health professionals omo hia no omo dey nkofo be call. And then together no we hope say it will get benefit there. Western North is going to benefit because postings no more no about 30%, 20% of it no. Ghana 900%. Western North able to make 30%. And I said 25%, 25%. So looking at that no, I would say say a yade a beboa ama your health no apaja and find to
All right. Comment back on up your TikTok or say I'm patiently seated, looking forward to watching Mate. I just say oh support him. And I just say Omaji Akunya Omosheno. Aha minimum no. Give a common your so coordinator. Ono waji Akunya or share yeni abema or TikTok. Okoha also bit me like a video no na wahyɛ bibia atoa so amaye. Yɛhwɛ when it comes to Western North, yeah, maka concerning other regions, no, we are not focusing on those people. We are just looking at how our employment, especially next recruitment, a better benefit in. And then this year, our health minister in as part of our MPs, not just a bibinia. Yes, yeah, no, said them I indeed jam. I say, oh, they said them. Western of SA also a benefit. Yeah, share with the struggle of staffing, the effect of it. because the same issue about thought that better say demonstration be because of staff no Easter. We are like say okay, you need spend no you ain't me for bebree.
Em fa we
Nti wo hia for kwa na yam out two no ese mo manage yam koko two jobs. Are we going to see that or NDC
Yes,
have the plan to
okay,
close the gap?
okay, I said minister that can volunteerism be so.
Okay.
Said there are some health workers that they were engaged them as volunteers. But some way volunteers as at when financial clearance be no. No ma absorb some for in the go system. So say we also government hospital. Here doctors and I say here nurse for 15. Now say the 10 aba.
Okay.
5 they will get 5 additional volunteers. They are willing to work to take an allowance. That's what I say. So once they are taking the allowance, 3 months time, financial clearance, every Ministry of Health, Ministry of Finance, no man incorporate them into the payroll. No man shall say to your So what I will say is looking at the honorable Kwabena Mintakano, the Agu as health minister, I am sure and I hope say staffing gap, although say it's a challenger, you can't deal with it entirely, but at least we can take away 40%, 50% of the staffing gap. Looking at initiative, see enrolling in year, 50% of the staffing gap will be a thing of the past. So I believe in that initiative.
Okay.
Say yeah, postiness for the aba. Now if you engage you more on mama volunteers, they will take allowance and then subsequently they will be absorbed onto the payroll. Doing that, I think staffing gap will solve.
All right. Yeah, share a ban health sector and a health facility or Western offer. You share NDC MPP. You share a ban facility. Say you build a facility because they say me when they say one of the best health projects ever been your regional hospital. No. Aside that, any other health projects and I even already existing one NDC
Yes,
are working on.
In fact, hospitals need be
Okay.
MPP CB.
All right.
You need back when you were assigned to
Mm-hmm.
Honorable Dr. Kukwefri, time I know your health minister, and I started. In fact, and we on board commission recently. And this year, so you buy so you Oko de Biswa, your Cocoa Clinic. Cocoa Clinic is a subsidiary under Cocoa, a buying company. 2009, and he started our hospital in 2013. Under President, former President J. Mills, and former President, I can't say John Mahama. And so we be complete. Yeah, okay. Oko Akontomra Hospital and there was one on Baby redevelopment. In the year 2014, Omkoje Busia B. Nabosin a friend of Oreo supported hospital projects.
Okay.
What I say? That time nani na boom here, Western region, 2014. Hanchi. Now you capture some of the hospitals, as in Western region and then Western North region. Western North the nya Lubo and Akontomra.
Okay.
Contract sum no 26 million euros. But what I say. Hospitals are crying hospitals ni be Akontomra, Elubo, Bogoso, Mpoho, Nswayem, and Wasadunkwa. All those hospitals were captured under the Oreo supported hospital project at NDC. Now we trace it back to the days of the also government hospital 1997, President Rollins and a year under NDC1, President Rollins. And Sana subsequently Ababenya the redevelopment na Ebobaba. So aside this, we have chips compounds, we have clinics over there. I know when NDC there, they are undertaking.
But when you say project MPP is also claiming for some of these projects. Mame failed to some of the projects.
Okay.
Oshe project we are boarding Cocoa Hospital no. The Bisudia no. They say according to MPP, make sure omo project bureau. Based on that, they said they constructed this hospital through
under MPP, project, the same project bureau.
Okay.
No one must say factory or yours. When in factory,
Miracle.
When in miracle, waste management plant na wo abu ni bia no. MPP ni si. MPP ni si.
Oh, maybe it will be Sammy and I say
you feature Europe long ago, a abroad company. But almost see Oko omu project bureau na wo. Omu you say oh they have a name for that bureau. I've forgotten it. Project tracker we say bibisa.
Oh yeah no MPP project bureau.
And I'm just saying we could have the project bureau no it was started from omu development tracker we say project tracker. There was a name. Omu see factory ewo Western North region. Factory no omu see Eurocop na here obi company no. It has been captured. And my catch was there. Oko Debiswa Coco Clinic no. President John J.E. Mills na started here was under Coco board. Coco Clinic initiative na ankasa President Mills and the buy. So you see then President Kufo and the best started. They can also at them can say. Now once I make was say MPP IC hospital Western North.
Yeah.
Oko assign so government hospital MPP see. There is no we be dispute that fact. But what I'm telling you, we've also done our best in this hospital projects. No, Baku that the Bisu Coco Clinic, it be the Akontomra government hospital and some MPP by redevelopment. So as I say, I'm not sure the sources of that idea. Because we are supposed to government hospitals, so the same thing. They can watch I say. So there are other hospitals that, in fact, they also claim only some more there.
Yeah, other Dr. Kokwe free.
They will tell you say. University of Ghana Medical Center but let me show you something here. Let me show you something here. This is Google. The Gaboso Government Hospital began operations in 1997 as a key healthcare facility in the Western North region. The facility has been undergoing development with recent expansion and infrastructure upgrade to increase its capacity. So if you do an upgrade on a facility, it doesn't mean you started the project. They can watch them can say. So the additional facilities become man. When you say hospital American MPP see President Kufuor start here.
Okay.
But Kanya President Kufuor hospital will see you. They just brought infections and disease center no they come. It's just a segment of a hospital. We see hospital. Why expansion? They can watch I say.
Okay.
So we admit MPP see hospitals for Western of region. NDC, yes, hospitals for Western of region. You get what I'm trying to say?
Okay.
Yes. So that is the basis of that argument.
All right. Mame about this hospital, let's be more this government hospital, they are centers, some of them they are centers. Now are we planning aside body come back on agenda 111 hospitals
Yes.
body
The ones I can say two.
okay
Yeah, now back on I'm not talking about it. I come to redevelopment or maybe.
Okay.
But what I'm talking about is body and then Adabukuru. But we are looking at Adabukuru first.
What happened to the body one?
Body the no say every year we are completing 10.
Okay.
Every year we are completing 10. But don't forget say we have some 20% component there. This is assembly common for. And also somebody best so kakra before say 2027 be do yeah there another 10 be come. Because minister na say say as far as I know health minister no every agenda 111 initiative there you undertake the Western of we get our share, we get our quota.
Do you know about the Bisu Coco hospital?
Coco clinic.
Coco clinic.
It's not a hospital.
Okay.
It's a clinic. That's what I say. Coco say once a Coco border. The idea was that Coco workers in the world every month we are till what Oko hospital near the Akotia hospital bill.
Okay.
Company ni
for staff no.
Yes. And yes I didn't emphasize can be in Kosi hospital.
I send a SNET for year or more than
yes. Okay. Send a Bank of Ghana and so you be crowd.
Okay. The bank hospital.
Yes.
All right.
But that's what the American say. So that initiative was under President J.E. Mills. And no and a BFA, the Bisu Coco Clinic. In fact, it was started in 2009. When we and our President Mahama be complete in 2013. Together with Bialam Lighter College of Education.
Okay.
But that's what the American say. It was a promise I would make the people of the West. So we give them a hospital, you complete the hospital, and I give them a training college. In fact, training college, now a small facility, and or convert here into a training college. So, be barrier. If that stretch, no so, go Benjamin Health Center or NDC and hospitals or Nabu Community account. If I stretch, no so, if I stretch, no so air qua. ATK Kantankuro we bi wo. Saira no bi wo. Ni nyina wo andadwa aboso district. Ukwa kodu nsinsin bi wo. Maso ase. Ukwa nkronkro na wo bia on the health center. NDC yes eba na health center dia. Nansen kura no NDC under Polivansedu, former MP for Sevi also.
Okay.
Yes, bi wo you also Abonse Nansen ade e koye redevelopment Nansen the MP koye renovation Nansen.
Renovation. Honorable Dominic.
Yeah, no, Kofi Benta for honorable MC.
Okay.
That's what I say.
Yeah.
So talking about health centers, chips compounds. Yes, baby. So that one there, I don't see the difference. In fact, what we should look for, say, about BB. That's what I say.
Okay.
Governance is continuous, and about the also here. Omoka hospitals, I can also bet you say senior high schools are Western offer. About 80-90% of the NDC. It's either we built it and I say it was a school and then we converted it. You know what I say?
Okay.
In Kro Western offer, electricity ever Western offer. Don't know the history of electricity, how it landed in Western offer.
Yeah.
I don't know. It wasn't not President Rollins.
Okay. So
if you look it in that tangent, sir, Obia what the way.
Oh, maybe hospital.
Before God and man.
Okay.
Now Western of region, they who asphalt that. Maybe so. Near who asphalt.
Okay.
And yen this yen the asphalt by Western of. Do we the cans? Once I guarantee. But say MPP and can be a ombe static system. No, the so said there be a one of the asphalt by Western. But you see, we believe in development. We believe in say you develop or mine amount mine. This things about one SC hospitals do yes, will be enough for me there. But you can't West regional party ama regional by regional. Because imagine say omo kan organize some creative region. But looking at the Ghana Statistical Service data, any both parties or data now. Okay. It is assumed say NDC or Dom go Western of region CMP.
Yes.
And the year what Dom Western of region. Yang got 2 years or do. And the young for na to na region by. Young for now to know. And young fan say 70% or 30%. Young go for 70% in now. I remember say Western of region. Yeah, you dim your campaign because we wanted the region to come. You haven't what I say. So talking about development, yes, both parties will be enough for me there, and then we are still doing our part to make sure the region will succeed.
Okay. I asked my bro but told my member maybe say about this centers and this hospital, not because the person who party started.
Okay.
I'm asking because I want to know say Mokai this kind of centers any hospital because Bano centers now sometimes the renovation issue is headache because Johanna one of assemblyman be the request by say one Buakon North Electoral area Akurafo, right? Akurafu. Or sending your pictures and video of a more chip compound. Now, the structure now is
You see,
it's headache.
But every chips compound, every health center biano is in a constituency.
Okay.
Constituency is political. Over the local government is in a district or a municipal. That district or municipal has a district chief executive or a municipal chief executive. So municipal chief executive or that a district assembly and as a municipal assembly. So municipal assembly, Yamano district assembly common. Aside district assembly common fund the man, MPs common fund the mom, NHIS levy the mom, plus omo IGF. So if you are an assemblyman, who is an assembly member of a municipal assembly,
okay,
and you have this challenge, what do you have to do? Your first impression is bring it to the media.
I don't think it is the first time I will try, sir.
No, you see,
because I know say
and then
okay,
and I make answer way a renovation, and then do you know that the current MP is from that area?
Yeah.
And so has he informed the MP and the MP hasn't done anything about it? Then can what I say? This style of politics, we assembly members, you try to do something to just make sure the government looks unpopular.
Okay.
This thing, we shouldn't encourage it. We are all building this country. So if you have a challenge, your first point of call is the MP. God being so good, the MP is from your area. You are an assemblyman. you belong to a municipal assembly. Bring it on board. Let them structure their budget. Well, it's just about 10,000 people. They will be able to complete the project. Do you understand what I say?
Yeah.
So it shouldn't be always the media. Sometimes there are some of the things they can do it underground and by media. And by the time you realize there will be a commissioning, especially when the MP is from there. Because I'm sure if the MP is aware, and Kaseska EDC babies and mother unit or health center, maybe in Kaibet me decides can alcohol renovation or more in the catchment area and so and you're benefiting one.
But I know the MC and the MP did that for Omoko Eco Engage community. No, I'm sure they should also see it.
You see, yes, they might see it.
Okay.
But we have projects now. What this assembly or more less the last time na MP no bubo project akese yeah abandoned project on person here. Akese na makoma 9. Ewo the municipality.
Okay.
Now this project no abansi for 20% of your common fund back. And so what do you have to do? You bring the MP's common fund attached. Now do IGMs by the but doing that, you do it on a priority list. Health center, what air function, just a muhia renovation kakrebi. It is quite different from baby almost we need to cry. You can watch it. So first thing first, but I'm sure say that a health center, no, the MP will go and do it, and then and to say next year, you see a release about that MP. I believe in it.
My boss actually wanna say.
Oh, and yes, what boss actually because once the MP is from that area, you expect to say that area will be developed for them. I believe the MP can do
because project no near Muhiano is always stay a weighing center, improvement of electrical system, painting of the facility.
Yes, that is what I'm saying.
You cry me oh yeah, it's
you see, the Indian American say this thing no. I also tax you people say I'm finding out from the municipal assembly.
Okay.
But I said this thing has come to their decks. Now say about more decks, so what are they doing about it?
All right.
And then you can also find out from the MP's office too, so that you know say because you people are also here to assist. And you be an MP better. Sometimes when you hear it, you try to inform the MP, and then the MP also will take action so that it will be executed.
All right. And then yeah discussing Yama Bray. We are sure say cover Yama and yeah cover review
almost. Bibia.
Okay, say almost, and I say I finish do 25%. I said they say Bibia come on fire say 25%. And see when you say yeah 25, that for but na the 25 account. Na yeah quite news and then Kro Yi Mu Nsem dwumadie no yeah touch on the health sector. Nyama yeah the talk concerning health related issues or my mu any Western North per se. You share some of the facilities and centers you share some of the government hospitals. And I say officially your regional hospital no echo. Yenya TFE and this regional team member how Western North the NHS or say contractor now for side that means and I think is really going to help us. Me say at the end of the day because aka NDC be 2 or 3 years now you call back to election. That means do election time we don't really work on projects. Is it going to be a project I will do 50% now at the end of the day no na akoka ho to say send you who TVET na wo bo akone can what I say. Me sure say project na nya kra ya ma contractor na sika some level but project nkodu ba bia na akoye bibia ho then the project end up being in the bush for a long period and sana yet me away and then me who video from aferi wo ohwe cement aya pack egu cement na say ya ni nyina government ta ni nyina ya wo tax niema ba ku mienu bi a wo to yet o na ye de ato sa niema no ni nyina asay and it's waste yent me mfa nya hwe bi the project ni we shouldn't forget say enye say NDC for the bebo mo ho say omo na mo ye project and say MPP for so be share say omo na mo ye project and it's for the benefit of all of us health deɛ ehia paa. Imagine say onua bi anya kidney issue. Yes, yeah, asɛm no ɛto wa na wobɛhu the essence of some of this facility. Nti yɛhwɛ na yɛn nyinaa yɛn build it up. Yɛkɔmate hɔ na yɛakɔgye the final remark message ɔwɔ ma health workers because this issue at Confanoche Teaching Hospital no is disturbing. Yɛkɔ na hɔ na yɛakɔgye final words na upon 6:30 yɛbɛsɔre dwumadie no so na nea ɛwɔ hɔ biara nso yɛde atoa so ama wɔn. The last words na
Yo,
nkyia bi na
yɛkɔ no ma menkyia wɔatiefoɔ nyinaa.
my last words last message.
My last
health
message, you know,
workers.
they say we should all have hope in Honorable Kwabena Minta Kando as health minister.
Okay.
In fact, one of the few ministers so many years ago, he is determined to work for the betterment of Ghana in health sector. The message say, "You be born a chidom, na ya support ni chita ni na man na ya die abompa na nimdi there is be award ma Western of region Ghana as a whole in terms of health so ebeti my den aba me ko no amenchia achiefo nyina na menchia lady be friend Belinda
Okay.
o wasako mecha o tedwumadi na aven so na machia NDC fo nyina na machia MPP fo nyina so mo tedwumadi na machia won so
wachia MPP for achia men so wachia men so na men kai say Kwame out of asthma or not if he na chia or hwe se bibia bekoyi afifa can the pen wachoro kama on dey say ochoro jayo obachoro nti uhu news ye twagu ya bebre na ya afifa nsa no atia say how ba hard ya adwuma no obeye obechoro na cruiser say cruiser samo cruiser no ono nso eboae ma yɛde dwumadie wei ɛbrɛw din a yɛde frɛ me yɛ Nana Asare Kesse metena mu de Kro Yi Mu Nsem dwumadie a yɛahyehyɛ gu hɔ from 4 p.m. ɛkɔsi 6:30 berɛ biara Monday to Friday na kyena World Cup start ma menkae wo sɛ Koholavia hɔ na kɔgye wo DSTV decoder na biribiara ɛnyɛ kama ɛma wo ɛna afei Rakeoff sɛ menka nkyerɛ wo sɛ building materials na nneɛma ahodoɔ nyinaa wokɔ hɔ a wobɛnya bi na also wode akɔsi wo dan na biribiara ayɛ kama menim sɛ regional hospital wei ɛba yi ɛne project a ɛrekɔ so yi yɛntɔ yɛ nneɛma mfi Rakeoff hɔ because yɛtɔ a wobɛnya sika na wasan si accident and emergency unit no baako nso aka ho ɛde ama yɛ nti kɔ Rakeoff hɔ na kɔgye wo doors o paint o tiles ne nneɛma ahodoɔ bebree a wohia no wokɔ hɔ a wo nsa bɛka frɛ no wɔ 0243 317 578 0243 317 578 and I say 0244 878 460 0244 878 460 wofrɛ Rakeoff a wobɛgye wo so na biribiara akɔ kama ɛde ama wo Olavia nso sɛ bɛgye wo DSTV sɛ yɛyɛ ɔso ha yi ara na ɔhyɛ wofrɛ no a ɔbɛba na wabɛbɔ wo DSTV no ama wo gye ahoma no ansa na mmerɛ afiri 0248 554 851 0248 554 851 Olano no multi TV decoder wopɛ sɛ ɔbɛyɛ installation ma wa ɔbɛba bɛyɛ ama wo CCTV camera ɛne installation so Ola sɛ menka nkyɛw sɛ ɔbɛyɛ ne nyinaa ama wo solar system ɛne installation so Ola ɛbɛyɛ ne nyinaa ɛde ama wo ɔmo ɛna ɔmo asɔ yɛase ɛnɛ yɛde dwumadie a yɛato ne din Kro Yi Mu Nsem ɛde brɛ wo yɛstreaming live ɛwɔ Facebook YouTube ɛna afei TikTok din no yɛ Sahwe News wokɔ hɔ a na walike wahyɛ video no da so da hɔ wo a wopɛ sɛ wohwɛ wo mix live coverage no wopɛ sɛ wohwɛ no wobɛtumi adwene abra ya end live wei no wobɛtumi asan hwɛ video no na biribi a ɛwɔ hɔ biara no wogya wɔ comment section ase a meda so yɛ active wate ase mɛ reply wɔ comment no na nkɔmmɔ no yɛatoa so wɔ online sɛ digital space no ɛhɔ na yɛn nyinaa yɛwɔ nti mesɔre so kyena yɛde nkɔmmɔ a yɛde loan wo a wopɛ loan de support your business no from government na kyena yɛde ho nkɔmmɔ ɛbɛba abra abɔfoɔ pɛpɛɛpɛ ɛna afei yɛde ɛyɛ planning fiscal planning officer nso ɛbɛba ha na yɛabɛ discuss flood issue a ɛkɔ so wɔ Accra menim sɛ woahwɛ video no bebree a amanfoɔ de ɔmo bed yi a yɛsɛ ɛyɛ rubber no ɛfloti ɔde nneɛma gu so ɔde adane boat ɛna ɛfloti do we see that happening in Western North within 3 to 5 years. Buy your structures, send your ACC dime. Yeah, even you also as a capital, no, because I didn't know AC or Greater Accra, you also as a capital, no. We see that based on your structures, how do I AC? Then I say, oh, sure, you say lanes, negatives, you be quine, and can ama fee quine, we won't say negata ni quine. Do we see something like that happening within Western North? Ọba ọbɛkyerɛkyerɛ any plans ahodoɔ a wɔde agu akwan mu concerning structures are esi wrong places ɛne nneɛma a wɔde agu akwan mu. Nti yɛkyena bɔfoɔ pɛpɛɛpɛ a na wate nea wobɛhia yɛ wo data ɛne wo smart device woba a wobɛtumi ahwɛ program no live ɛwɔ Facebook, YouTube ɛna afei TikTok nso. Mesɔre so yɛbɛdi nkɔmmɔ nyambo akyina baasa na mɛkɔma mekyia nkurɔfoɔ baako mmienu bi list ne wa mekyia Edith wɔ Mpomam Rita nso wɔ Accra ase mekyia wo Emilia ahwia mekyia wo ɛna Esther wɔ Enche nso mekyia wo Paulina wɔ Ɔmahene News Site mekyia kɛse ɛnkɔma wo Franka also woyɛ wotɔn aduane wotɔn aduane ɛwɔ dwena ase mekyia kɛse ɛnkɔma wo nti wantimi din bi ma yamboa ɛkyina yɛbɛsɛ ahyia na Asare Kesse makram.
For the love of the game and the fans who cheer, Selwyn News is soaring high, making it all clear. Selwyn News, the best online portal in Western North. With every story, every goal, they're always close at hand. From transfer news to festivals, they're the ones we trust. Selwyn News, we building our tribe, raising our voices.